Ladies and gentlemen, if you'll take your seats, we'll reconvene. And we are now on the amendment in the nature of a substitute. Are there any other amendments? For what purposes, the gentleman from Massachusetts seek recognition?
Thank you, Mr. Chairman. I have an amendment at the desk.
The clerk, do you have the number? What number?
Oh, excuse me. I'm sorry. I believe it's number 37.
Clerk will report the amendment.
Sense of Congress. FMAP.
Amendment to the amendment in the nature of a substitute to H.R. 2646, offered by Mr. Kennedy.
Without objection, the reading of the amendment is dispensed with, and the gentleman is recognized 5 minutes in support of his amendment.
Thank you, Mr. Chairman, that they are willing to accept, and thus on the access to mental health care that they are able and willing to provide. It's a no-cost, common-sense amendment. It would say that enhancing the FMAP has historically helped states strengthen their systems and pay for upgrades. Medicaid is the largest single payer for mental health services in our country, not because it is the most generous, but because it serves such a high population of Americans with mental illness. In fact, in Massachusetts, Medicare reimburses doctors, Medicare, for about $116 for the evaluation and management of a new patient who presents with moderate severity, which takes about 30 minutes. But Medicaid payments may be limited to $62 to $83. Meanwhile, commercial reimbursement rates can pay up to $133 for the exact same service. If we are serious about addressing the mental health problem in the United States, we have to be serious about the way we pay for Medicaid. I ask my colleagues to join me in supporting this amendment, and I will yield to anybody that wants to chat about it, and if not, I'll yield back.
Chair thanks the gentleman. Is there discussion on the Kennedy amendment? The chair recognizes Vice Chair Mr. Guthrie, 5 minutes, strike the last words.
Thank you, Mr. Chairman. I appreciate and understand what my friend from Massachusetts is talking about, but the reason that I oppose the amendment, Medicaid already pays for 25% of behavioral health services. This amendment could cost federal taxpayers billions of dollars, and there's no CBO score, and we don't know its impact. And this policy just changes who to the federal government, and rather than empowering enabling states. And today should be about improving policies and programs, not just cost-shifting program dollars. And I yield back.
Will the gentleman yield?
Yield, absolutely.
As much as I might wish that the amendment actually did fund Medicaid for the reimbursement rates that I would like, all this proclaims to do is a sense of Congress that Medicaid, in fact, doesn't reimburse at commercially viable rates, and just mentions that. So I don't believe there is, in fact, any cost to.
You understand it's a sense. It's a
Yes.
sense of Congress, but it shows the intent, as I was referring to.
Thank
So
you.
I appreciate my friend from Massachusetts. Thank you.
Is there further discussion on the Kennedy amendment? If not, the vote occurs on the amendment. Do you want a roll call?
We can go ahead and roll.
Yes, please, Mr. Chairman.
Yeah. Roll this vote. All right. I'm told we're going to roll this vote until 5, so members, all the other members can arrive. All right. So,
Mr. Chairman. Mr.
the,
Chairman.
Yes.
My understanding.
We'll
start.
Record this vote.
Thank you.
Yeah. All right. Are there any other amendments to the amendment in the nature of a substitute?
Strike the last word.
All right. The gentleman's recognized 5 minutes. Strike the last words.
Mr. Chairman, I want to voice my support for the amendment that my friend Congressman Kennedy introduced that states that it is the sense of Congress that providing an enhanced FMAP for states to strengthen their behavioral health systems and foster integration would beneficially improve behavioral health services and access in this country. I'll be offering an amendment that builds on this provision during the markup as well. If we want states to invest in behavioral health infrastructure in their states, we need to provide an enhanced federal matching rate to prioritize these investments. I encourage my colleagues to support this amendment that would provide funds for states to strengthen their behavioral health systems. With that, Mr. Chairman, if there's no other time.
Gentleman yields back. Any further discussion on the amendment? If not, we will roll this vote, as I said, at 5, but let's proceed to the next amendment. Does anyone else have an amendment to the amendment in nature of a substitute? Anyone seek recognition? The gentleman, Mr. Pallone, is recognized to offer an amendment.
My amendment is number 17. Deals with the IMD short-term stays and managed care
The
Medicaid.
clerk will report the amendment.
Amendment to the amendment in the nature of a substitute to H.R. 2646, offered by Mr. Pallone.
Without objection, the reading of the amendment is dispensed with, and the gentleman, Mr. Pallone, is recognized 5 minutes in support of his amendment.
I'll be brief, Mr. Chairman. This amendment relates to the so-called Medicaid IMD exclusion. Something that is often forgotten is that the majority of Medicaid beneficiaries are in managed care, particularly for their mental health benefits. And this means that for Medicaid beneficiaries in my home state of New Jersey, for example, a private plan is paid a per-member, per-month capitated payment from the state to manage all benefits. In July, CMS proposed a rule that would allow for an up to 15-day IMD stay for Medicaid beneficiaries in managed care. And this is a common sense, appropriately nuanced policy that ensures the pendulum doesn't swing back towards incentivizing institutionalization, but the services are available to Medicaid beneficiaries if they need them. And we can make this policy permanent right now. Unlike broad-scale IMD repeal, the costs with this amendment are fundamentally controlled because of the very nature of managed care as a capitated payment, and beneficiaries will receive the need. And so I would urge my colleagues to support this amendment and yield back.
Chair, thanks the gentleman. Is there
Mr.
further
Pallone?
discussion on the Pallone amendment?
Yes.
The gentleman, Dr. Murphy, is recognized.
Mr. Pallone, I like your amendment, and I actually hope that we will accept that. This policy implements a lot of provisions of the Medicaid managed care regulations that's been proposed by the Center for Medicare and Medicaid Services. Excuse me. And under this policy, Medicaid managed care plans cover up to 15 days of service for the beneficiary, which you said. That's a good idea, and actually the 15 days takes care of a large percentage of those with severe mental illness who need inpatient care, because it usually takes a couple weeks to stabilize or stabilize medication, et cetera. We've gotten a lot of positive support for this. It's one of the reasons why we want to take care of the IMD exclusion overall, even though that cost may be very high. But today, more than half, they need to have that flexibility which you raise. And as more and more states turn to managed care plans to help reduce the financial and administrative challenges of operating their Medicaid program, this policy, which you talk about, is a very useful tool. I agree with you. I support this amendment. I think we should adopt this amendment as we move forward to full committee. So, Mr. Chairman, I hope we can adopt it. I yield back.
All right, the
Sounds good to me.
gentleman accepts the amendment. Is there any further discussion
You don't want to vote on that, right? We just
on the amendment? We can voice vote if that's okay.
Sure.
All right, all those in favor shall signify by saying aye.
Aye.
Those opposed, nay. The ayes have it, and the amendment is agreed to. All right, we're at 5 o'clock, so we're going to do the roll call vote on the Kennedy amendment. The clerk will call the roll.
Mr. Guthrie? No. Mr. Guthrie votes no. Mr. Barton? Mr. Barton votes no. Mr. Whitfield? Mr. Shimkus? Mr. Murphy? Mr. Murphy votes no. Mr. Burgess? Mrs. Blackburn? Mrs. Blackburn votes no. Mrs. McMorris Rogers? Mr. Lance? Mr. Lance votes no. Mr. Griffith? Mr. Bilirakis? Mr. Long? Mr. Long votes no. Mrs. Elmers? Mr. Collins votes no. Chairman Upton? Mr. Green?
Yes.
Mr. Green votes aye. Mr. Engel? Ms. Capps? Ms. Capps votes aye. Ms. Schakowsky? Mr. Butterfield? Ms. Castor? Ms. Castor votes aye. Mr. Sarbanes? Ms. Matsui? Ms. Matsui votes aye. Mr. Lujan? Mr. Lujan votes aye. Mr. Schrader? Mr. Schrader votes aye. Mr. Kennedy? Mr. Kennedy votes aye. Mr. Cardenas? Mr. Pallone? Mr. Pallone votes aye. Chairman Pitts?
No.
Chairman Pitts votes no.
Are there others wishing to vote? Gentleman from Kentucky?
Mr. Whitfield votes no.
Gentleman from Florida?
Mr. Bilirakis votes no.
Judge?
Mr. Butterfield votes aye. Ms. Schakowsky votes aye.
Any, Dr. Burgess votes no.
Dr. Burgess votes no.
Anyone else seeking to vote? If not, the clerk will record the vote, or report the vote.
Mr. Chairman, on that vote, there were 10 ayes and 13 nays.
All right, so the nays have it, so the amendment is not agreed to. Are there any other amendments to the amendment in nature of a substitute? The gentleman from Massachusetts is recognized to offer an amendment. What's the number?
Thank you, Mr. Chairman. Move to strike, or have an amendment at the desk. It is, should be number 18,
18.
expanding.
By Mr. Kennedy.
Without objection, the reading of the amendments dispensed with. The gentleman from Massachusetts is recognized for 5 minutes in support of the amendment.
Thank you, Mr. Chairman. Mr. Chairman, this amendment would expand access to care for children under the age of 21 by correcting a quirk in the law that says that kids on Medicaid can't get both mental health care and physical health care when they are patients at certain facilities known as IMDs, Institution for Mental Diseases. This amendment would lift the current restriction that prohibits children in IMDs from accessing Medicaid's early and periodic screening, diagnosis, and treatment services, which includes immunizations, dental care, and physicals. Right now, Medicaid can pay for services the IMD provides, like counseling, for example, but cannot simultaneously pay for a child to get a cavity filled or a flu shot. Regardless of how members on the subcommittee feel about IMDs, we can all agree that forcing children to choose between mental health care and physical health care is bad policy. The current discrepancy is discriminatory, is bad for kids, and can be a deterrent to crucial medical health care treatment. I ask my colleagues to join me in supporting the amendment, and I'll yield to anybody here that wants to speak or
Gentleman
yield
yields back.
Yes, sir.
Is there further discussion on the amendment? Dr. Murphy, you recognize 5 minutes.
Thank you, Mr. Chairman, and my friend, Mr. Kennedy. This is one of these things that is very important we have to work on. And I would ask, Mr. Chairman, in the context of the Health Subcommittee, that this is something you hold a hearing on. Because the early screening of children, actually throughout early childhood and beyond, is something that we're beginning to understand more and more, looking at early signs, for example, of autism, learning disorders, et cetera. I know that we're already concerned about CBO scores because of the IMD exclusion with bed space. We should delve further into this, and I hope, Mr. Chairman, this is something that the full Health Subcommittee can dig into. We may not accept today's amendment, but get the kind of information which we all need on this, because we want this early identification of children. And quite frankly, I think we're going to need a deeper dive in this and more breadth in this as well. So I yield back my time.
Chair, thanks, gentlemen. Is there further discussion on the Kennedy amendment?
Mr. Chairman.
The chair recognizes the ranking member, Ms. Pallone. Strike the last words.
I'm speaking in support of the Kennedy Amendment. There's something we could do here today for very little cost that would end discriminatory treatment of seriously mentally ill children in Medicaid. When the Medicaid program was established in 1965, it included an exclusion on federal reimbursement for so-called, quote, institutions of mental disease. At the time, mass institutionalization of the mentally ill in this country was a serious problem. And I want to clarify my view that today even, it's still very important that we carefully maintain the balance between community services and institutionalization. The important thing, though, is to ensure that Medicaid beneficiaries have access to establish an exception to the IMD exclusion for individuals under age 21. The Psych Under 21 benefit allows Medicaid kids to receive inpatient psychiatric hospital services if that's what they need. Unfortunately, because of the way that the benefit is structured in the statute, which looks very different from children's health coverage today, the federal government will only reimburse states for the inpatient psychiatric hospital services provided in Medicaid-enrolled children and youth in these facilities, not for any other services a child receives until unconditionally discharged from the IMD. and a temporary discharge to treat emergency medical needs is not an unconditional discharge. Congress has since ensured that our most vulnerable children have access to the services they need. Under the early and periodic screening, diagnosis, and treatment mandate, states must provide all medically necessary Medicaid services to kids. Unfortunately, for our most seriously mentally ill children, that same fair access to Medicaid benefits does not apply. And this is discriminatory to our most seriously mentally ill children, disincentivizes families to seek this type of treatment, and disrupts the regular continuity of care that we're trying to keep children healthy, but also this ensures that a child is tracked by a physician regularly who can catch any future relapses, whether they be for mental or physical health reasons. The policy costs the equivalent of peanuts given the numbers we often throw around. $350 million to fix discriminatory treatment of children and IMDs. That's it. And so I think this amendment is common sense. No child, regardless of their mental state, should be denied the care they need. And I appreciate the fact that Mr. Kennedy is putting this forward.
I think this is one of the most important amendments if we're really going to look at getting on the front end of mental illness, particularly for children. I know the cost is in there, but I'm looking at language that says, however, Section 501 would not take effect only if the Chief Actuary of CMS certified that providing assistance does not increase program spending. But this is something, if we're really going to reform mental health treatment in our country, to go where the children are so we can see what's developing there. And I want to thank Congressman Kennedy for introducing this amendment. And I do think we throw around large numbers oftentimes here, but I think this would be worthwhile for the long term. It would be actually long-term savings, I think. But thank you for yielding to me. I yield back.
Chair thanks the gentleman. Is there further discussion on the Kennedy amendment? Since there's no further discussion, the vote occurs on the amendment. Do you wish to record a vote?
Recorded vote.
The clerk will record the vote.
Mr. Guthrie? No. Mr. Guthrie votes no. Mr. Barton? No. Mr. Barton votes no. Mr. Whitfield? No. Mr. Whitfield votes no. Mr. Shimkus? Mr. Murphy? Mr. Murphy votes no. Mr. Burgess? Mrs. Blackburn? Mrs. Blackburn votes no. Mrs. McMorris Rogers? Mr. Lance? Mr. Lance votes no. Mr. Griffith? Mr. Bilirakis? Mr. Bilirakis votes no. Mr. Long? Mr. Long votes no. Mrs. Elmers? Mr. Bouchon? Mr. Bouchon votes no. Mrs. Brooks? Mrs. Brooks votes aye. Mr. Collins? Mr. Collins votes no. Chairman Upton? Votes no. Chairman Upton votes no. Mr. Green?
Aye.
Mr. Green votes aye. Mr. Engel? Aye. Mr. Engel votes aye. Ms. Capps? Aye. Ms. Capps votes aye. Ms. Schakowsky? Aye. Ms. Schakowsky votes aye. Mr. Butterfield? Ms. Castor? Ms. Castor votes aye. Mr. Sarbanes? Aye. Mr. Sarbanes votes aye. Ms. Matsui? Aye. Ms. Matsui votes aye. Mr. Lujan? Aye. Mr. Lujan votes aye. Mr. Schrader? Aye. Mr. Schrader votes aye. Mr. Kennedy? Aye. Mr. Kennedy votes aye. Mr. Cardenas? Mr. Pallone? Aye. Mr. Pallone votes aye. Chairman Pitts?
No.
Chairman Pitts votes no.
Are there other members wishing to vote? Dr. Burgess?
Dr. Burgess votes no.
Mr. Shimkus?
Mr. Shimkus votes no.
Mr. Butterfield?
Mr. Butterfield votes aye.
The clerk will report the vote.
Mr. Chairman, on that vote, there were 13 ayes and 14 nays.
All right, the nays have it. The amendment is not agreed to. Are there any other amendments to the amendment in nature of a substitute?
Sarbanes? John? You're up. No? Joe, you want to do yours?
All right, the chair recognizes the gentleman from Massachusetts to offer his amendment. What number?
Number 20, please, Mr. Chairman.
Number 20. The clerk will report the amendment.
Amendment to the amendment in the nature of a substitute to H.R. 2646, offered by Mr. Kennedy.
Without objection, the reading of the amendment is dispensed with, and the gentleman, Mr. Kennedy, is recognized for 5 minutes in support of his amendment.
Thank you, Mr. Chairman. Mr. Chairman, despite this country's mental health parity laws, I hear stories far too often about people with insurance who are struggling to secure mental health benefits, especially when it comes to substance abuse. Beneficiaries can't find doctors in network, they are inexplicably denied coverage, and they can't get the information that they need to make smart decisions about their coverage and care. NAMI recently released a report entitled The Long Road Ahead, and it found, quote, insurers are denying authorization for mental health care at higher levels than they are for other types of care, end quote. Another study found that out of 84 plans, only 15 made detailed plan documents available to consumers. This lack of transparency is making it impossible for us to ensure parity laws are applied and enforced. This amendment would strengthen parity for mental health and substance abuse by infusing the system with accountability. It would require health insurance plans to share the analyses they perform in determining coverage benefits, and would empower regulators to conduct audits to share their findings publicly. Very similar language is already in the Senate version of the mental health bill, though I should note that one key difference is that this amendment would create a patient parity portal so that patients have a one-stop website for submitting complaints and reading the publicly available information. I ask my colleagues to join me in supporting this amendment. I'll yield to anybody that wants to speak in support, or I will yield back.
Chair, thanks to the gentleman. Is there any discussion
Mr. Chairman.
on the Kennedy amendment? Who's seeking? The gentleman, Dr. Bashan, is recognized. Strike the last word.
Strike the last word, Mr. Chairman. Mr. Chairman, I oppose this amendment. Congress has already taken big steps forward in the last decade related to mental health parity. But this amendment includes burdensome new mandates, audits, and requirements. And this amendment has not been considered in a legislative hearing. Also, this amendment seeks to make changes to federal statutes outside the jurisdiction of our committee, including ERISA and the Internal Revenue Code. Finally, we do not have a CBO score or independent analysis about how this amendment could increase costs for taxpayers or consumers. I oppose this amendment and urge my colleagues to oppose it. I yield back.
Is there further discussion on the Kennedy amendment? The gentleman, Mr. Plone's recognized. 5 minutes. Strike last words.
I want to speak in support of the amendment again, which would strengthen parity in mental health and substance use disorder benefits. The 2008 Mental Health Parity Act, which I introduced, extended mental health parity through 2008 and required health plans to treat equally mental health benefits and medical surgical benefits. Unfortunately, despite this important step, too many individuals were experiencing gaps in coverage and many services were not receiving the benefit of federal parity protections. Too often, patients would report of being informed of their coverage for mental health or substance abuse being cut off or limited in some way, despite the continued need for such coverage. In order to address this, the Affordable Care Act expanded coverage of mental health and substance use disorder benefits and federal parity protections in 3 key ways. 1, including mental health and substance use disorder benefits and the essential health benefits for new insurance policies, ensuring that consumer purchasing health coverage can be sure that their health plan will provide the care they need. 2nd, applying federal parity protections to mental health and substance use disorder benefits in the individual and small group markets, extending access to coverage to millions of individuals in both the individual and small group markets. And 3rd, providing an additional 32 million Americans with access to quality health care that includes coverage for mental health and substance use disorder services. Unfortunately, mental health coverage still suffers from disparities from state to state, gaps in insurance coverage, and a shortage of mental health providers and treatment facilities. In fact, a recent study by the Johns Hopkins Bloomberg School of Public Health found that 1/4 of health plans are still not offering parity for mental health services, with some plans requiring different copays or deductibles for mental and physical health services or more strict requirements for prior authorization for mental health services. The amendment before us today, offered by Mr. Kennedy, is meant to help further in any violations and will also require increased audits and enforcement by the federal agencies responsible for implementing parity. Consumers will also have access to a portal to submit parity-related complaints and violations and access to information from audits that were conducted. It's my hope that this Kennedy amendment will help provide greater transparency about the steps insurers are taking to ensure parity for mental health and substance use disorders, and will provide consumers with a critical tool to reporting violations. So I urge my colleagues to vote yes on this amendment. But you know, before I finish, Mr. Chairman, I did want to say that, you know, I know this is sponsored by our own Joe Kennedy, but, you know, for years, and I'm going back to this 2008 Mental Health Parity Act, you know, Patrick, his cousin, was very much involved with this. You know, his uncle, or I guess great uncle, Senator Kennedy. You know, the family, and probably his dad Joe as well. They've all been involved in this parity issue, and we've made great progress in the parity issue. And I think most of that is because of the Kennedy family. I have to mention that. I yield back.
Chair, thanks, gentlemen. Is there further discussion on the Kennedy amendment? If not, you want a roll call?
Joe, roll call. Yes.
The clerk will call the roll.
Mr. Guthrie? No. Mr. Guthrie votes no. Mr. Barton? Mr. Whitfield?
No.
Mr. Whitfield votes no. Mr. Shimkus? Mr. Shimkus votes no. Mr. Murphy? Mr. Murphy votes no. Mr. Burgess? Mr. Burgess votes no. Mrs. Blackburn? Mrs. Blackburn votes no. Mrs. McMorris Rogers? Mr. Lance? Mr. Lance votes no. Mr. Griffith? Mr. Bilirakis? Mr. Bilirakis votes no. Mr. Long? Mr. Long votes no. Mrs. Elmers? Mr. Bouchon? Mr. Bouchon votes no. Mrs. Brooks? Mrs. Brooks votes no. Mr. Collins? Mr. Collins votes no. Chairman Upton? No. Chairman Upton votes no. Mr. Green?
Aye.
Mr. Green votes aye. Mr. Engel? Aye. Mr. Engel votes aye. Ms. Capps? Aye. Ms. Capps votes aye. Ms. Schakowsky? Aye. Ms. Schakowsky votes aye. Mr. Butterfield? Aye. Mr. Butterfield votes aye. Ms. Castor? Ms. Castor votes aye. Mr. Sarbanes? Mr. Sarbanes votes aye. Ms. Matsui? Ms. Matsui votes aye. Mr. Lujan? Mr. Lujan votes aye. Mr. Schrader? Mr. Schrader votes aye. Mr. Kennedy? Mr. Kennedy votes aye. Mr. Cardenas? Mr. Cardenas votes aye. Mr. Pallone? Mr. Pallone votes aye. Chairman Pitts?
No.
Chairman Pitts votes no.
Are there other members wishing to? I'm sorry. How's Dr. Emergency recorded? Mr. Barton, how do you vote? No.
Mr. Barton votes no.
The clerk will report the vote.
Mr. Chairman, on that vote, there were 13 ayes and 16 nays.
The nays have it. The amendment is not agreed to. Are there any other amendments to the amendment, nature for substitute? The gentlelady from Illinois, Ms. Schakowsky, is recognized to offer an amendment. What number?
Amendment number 38. I have an amendment at the desk.
The clerk will report the amendment.
Amendment to the amendment in the nature of a substitute to H.R. 2646, offered by Ms. Schakowsky.
Without objection, the reading of the amendment is dispensed with. The gentlelady is recognized for 5 minutes in support of her amendment.
Thank you, Mr. Chairman. I hope that everyone who's watching right now, there have been a number of really important amendments actually passed. My amendment would help to fill an unmet need for suicide prevention for adults, and I hope that you'll consider this. We have seen the amazing impact of the Garrett Lee Smith Memorial Act has had on reducing youth suicides. However, the Garrett Lee Smith Memorial Act almost exclusively focuses on suicide among youth and adolescents. Yet in 2013, 87% of the people who died from suicide were over the age of 24. And just this week, a Princeton analysis concluded that white, middle-aged Americans are dying at an alarming rate from suicide and alcohol and drug abuse. Actually, I believe it was, let me just see, I think it's white men. Yes. From 2000 to 2012, the rate of suicide among white male adults aged 45 to 54 rose from 15 per 100,000 people to 25 per 100,000 people, and now accounts for more deaths among this group than diabetes or chronic liver death, and is nearly the same as lung and cancer deaths. I'd like to request that this study from Princeton be included in the record. Mr. Chairman, I ask unanimous consent.
Without objection, so ordered.
Thank you. Unfortunately, many rural areas are also experiencing an increase in the number of suicides. According to the CDC, from 2004 to 2013, suicide in rural counties in the United States increased by 20%. The same data showed that Wyoming residents have the highest rate of suicide, closely followed by Alaska, Montana, New Mexico, and Utah, all of which have significant rural areas. I'd like to request that an article from yesterday's New York Times entitled "Small Towns Facing Rising Suicide Rates" also be in the record. So I ask unanimous consent to do that.
Without objection, so ordered.
Thank you. It is around here knows that's not a lot of money, but it is significant for 5 years to help implement and expand suicide prevention efforts for adults, and hopefully with these new findings, we can begin to reverse this devastating trend, and I urge my colleagues to support this amendment. I yield back.
Gentlelady yields back.
or
Is
to
there
anyone
further
who might-
discussion? Dr. Murphy, you recognize 5 minutes, strike last words.
Thank you, Mr. Chairman. These are grants, I believe, listed that the Administrator of Substance Abuse and Mental Health Service Administration, or in this case, under our bill, the new Secretary of Mental Health and Substance Abuse would have. There already exists a grant program within SAMHSA for suicide issues, plus our underlying bill calls upon the National Institute of Mental Health to do research on the determinants of self and other directed violence and mental illness, including studies directed at reduction the risks of self-harm, suicide, interpersonal violence, and also additional funds for the brain research so we can look at the underlying neurobiological causes of this as well as social causes. We know that what has been happening over the last several years, last 10 years, we have seen declines in mortality rates for heart disease, AIDS, cancer, auto accidents, and several other factors have all declined. They've gone up for suicide. They have gone up for substance abuse deaths. So in the context of what's been happening with how these have been happening, and there's been money put into this through SAMHSA, the results just have not been good. This is why we have in place in this bill the policy lab, which will review how grants are put together and how they've been administered, because we go back to the General Accounting Office, which says grants within the agency did not have accountability, they didn't have to report results, and that's a fundamental reform we have in this. So what I say is we're already having these grants, and it hasn't been working under the current structure, and I believe what we need to continue to do is have the grant programs we have, support the increased grants under NIMH, and make sure we reform the system so it really is working on this issue that Ms. Schakowsky and several other members know about. I know Ms. Blackburn would like some time, so I'm going to yield to her. Thank you.
Thank you, Dr. Murphy, and I thank Ms. Schakowsky for her remarks, and I understand the intent of her amendment. The way Dr. Murphy has structured this bill is to put the focus on changing what the deliverables are for SAMHSA and putting the attention on what is happening with the suicide rate. And I was just discussing with Dr. Murphy this Ann Case and Angus Deaton article that had come out from pnas.org today that talks about the rising morbidity and mortality rates. And as he mentioned, when you look at the chart, it is going up when it comes to drugs and alcohol and to suicide. And that is positioned within the department and have some deliverables that are there, as Dr. Murphy has said, and they exist in the underlying part of the bill. And I yield back to the gentleman from Pennsylvania.
I'll yield to Mr. Lance.
Thank you. I certainly defer to Dr. Murphy on the substance of the amendment, but I do want to commend Representative Schakowsky for introducing the study from Angus Deaton and Ann Case, close friends of mine. And 2 weeks ago, Angus Deaton won the Nobel Prize in Economics. And their study, which obviously I have read, I commend to the entire committee and through the entire committee to the Congress. Angus Deaton and Ann Case, husband and wife, are, in my judgment, the premier researchers in this area in the entire world, but placing that in the record. Thank you, Dr. Murphy.
Gentlemen, yield back.
I yield. Yes.
Is there further discussion
Ms. Capps.
on the Schakowsky amendment? Gentlelady from California, Ms. Capps, recognized. 5 minutes. Strike last word.
I'd like to yield to my colleague from Illinois, Ms. Schakowsky.
Like the minority fellowship program that isn't authorized, that we did authorize for the first time in Dr. Murphy's bill, we should authorize a program for adult suicide. We can control how it looks by authorizing it. And your argument supports why we should actually authorize this in statute for the very first time. And, you know, you're talking about yet another study. It seems to me that we ought to authorize a program and then make sure that we shape it the way that we want to. And I just think that, you know, you've talked about those things that we shouldn't put off because people are suffering and people are dying, and I certainly think this is one of them. I don't know if anybody wants time. Otherwise, I yield back.
The lady yields back. Is there further discussion on the Schakowsky amendment? Seeing none, do you want to record a vote?
Jane, you want a recorded vote?
We'll have a
Yes, I want a recorded vote. Sorry.
recorded vote. The clerk will call the roll.
Mr. Guthrie. Mr. Guthrie votes no. Mr. Barton. Mr. Barton votes no. Mr. Whitfield. Mr. Whitfield votes no. Mr. Shimkus. Mr. Shimkus votes no. Mr. Murphy. Mr. Murphy votes no. Mr. Burgess. Mrs. Blackburn. Mrs. Blackburn votes no. Mrs. McMorris Rogers. Mr. Lance. Mr. Lance votes no. Mr. Griffith. Mr. Griffith votes no. Mr. Bilirakis. Mr. Bilirakis votes no. Mr. Long. Mr. Long votes no. Mrs. Elmers. Mr. Bouchon. Mr. Bouchon votes no. Mrs. Brooks. Mrs. Brooks votes no. Mr. Collins. Mr. Collins votes no. Chairman Upton. Chairman Upton votes no. Mr. Green. Mr. Green votes aye. Mr. Engel. Mr. Engel votes aye. Ms. Capps. Ms. Capps votes aye. Ms. Schakowsky. Ms. Schakowsky votes aye. Mr. Butterfield. Mr. Butterfield votes aye. Ms. Castor. Ms. Castor votes aye. Mr. Sarbanes. Mr. Sarbanes votes aye. Ms. Matsui. Ms. Matsui votes aye. Mr. Lujan. Mr. Lujan votes aye. Mr. Schrader. Mr. Kennedy. Mr. Kennedy votes aye. Mr. Cardenas. Mr. Cardenas votes aye. Mr. Pallone. Mr. Pallone votes aye. Chairman Pitts. Chairman Pitts votes no.
Clerk will report the vote.
Mr. Chairman, on that vote, there were 12 ayes and 15 nays.
The nays have it. The amendment is not agreed to. Are there any other amendments to the amendment in nature of a substitute? Chair recognizes the gentlelady, Ms. Matsui, to offer an amendment. What's the number?
Number 30, I believe.
30. Clerk will report the amendment.
Amendment to the amendment in the nature of a substitute to H.R. 2646, offered by Ms. Matsui.
Without objection, the reading of the amendment is dispensed with. The gentlelady, Ms. Matsui, is recognized for 5 minutes in support of her amendment.
Thank you, Mr. Chairman. Sadly, the mental health of older Americans is often ignored in our conversations about mental health reform. However, there is an unrecognized prevalence of mental health disorders among older Americans. In fact, an estimated 20% of adults aged 65 and older met criteria for a mental health disorder, and more than 50% of nursing home patients has some form of cognitive impairments. Despite this, older Americans face serious barriers to accessing appropriate mental health treatment. Older adults with signs and symptoms of mental disorders are less likely than young and middle-aged Americans to receive mental health services. And even when they do, these services are less likely to be delivered by a mental health specialist. There are a number of cited reasons for this underutilization, including a shortage of trained geriatric mental health providers, lack of mental health and aging services providers, and other systemic barriers such as access to transportation. Preventing suicide among older Americans is also a pressing community need. Suicide events and attempts are often more lethal in older adults than in younger adults, in part because they are physically more vulnerable, and in part because they are more isolated. Because of this, suicide intervention must be more aggressive than for younger Americans. Mental health reform must not ignore unique mental health needs of older Americans. For these reasons, I introduced this amendment to expand mental health outreach to older Americans and to implement suicide prevention and intervention strategies. We must ensure that our aging population is not overlooked as we press forward with mental health reform. Thank you, Mr. Chairman, and I yield back.
Gentlelady yields back. Is there further discussion on the Matsui amendment? Gentlemen, Dr. Murphy recognized 5 minutes to strike last words.
Thank you, Mr. Chairman. There's a number of amendments I see that are coming up directing funding within Substance Abuse and Mental Health Service Administration to become the Assistant Secretary's office in specific areas. There already are grant programs on suicide. There are already grant programs on seniors. There are already grant programs on children. There's already grant programs on a wide range of these things. So first of all, they already exist. Secondly, an underlying function of this bill, which is so critically important, is to transform how these grants are done. Because the GAO report said the problem is how they're administered. They're given out, they don't require data, they don't require results. In many cases, the agency could not even produce the paperwork for them. And I think that given the fact that suicide rates have continued to climb and substance abuse rates have continued to soar, while other areas of health care have declined, the issue is not just the money, because the money is already there. The issue is how the grants are administered. That's the key thing we have to do here. And so rather than take the funding within SAMHSA and start directing it, and it's already directed, what we need to make sure is we restructure how they are done, make sure there's accountability, make sure that the policy lab, which is going to be created within the department or within the Assistant Secretary's office to restructure these things, we get through all these things. I mean, I find effective the flexibility to put these where it is needed with the accountability that must be there so we don't continue these high mortality rates. So as these come through, I mean, I oppose them. I recognize the need to do that, but I just want to make sure that among the dollars within this agency, we're not locking them all in for things before we have also reformed how they're given out. And unless anyone else wants time, I yield back.
Chair, thanks, gentlemen. Is there further discussion on the Matsui amendment? If there's no further discussion,
I'd like a roll call, please.
Mr. Barton. Mr. Barton votes no. Mr. Whitfield. No. Mr. Whitfield votes no. Mr. Shimkus. No. Mr. Shimkus votes no. Mr. Murphy. No. Mr. Murphy votes no. Mr. Burgess. Mrs. Blackburn. Mrs. Blackburn votes no. Mrs. McMorris Rogers. Mr. Lance. Mr. Lance votes no. Mr. Griffith. Mr. Griffith votes no. Mr. Bilirakis. Mr. Bilirakis votes no. Mr. Long. Mr. Long votes no. Mrs. Elmers. Mr. Buchanan votes no. Mr. Green.
Aye.
Mr. Green votes aye. Mr. Engel. Mr. Engel votes aye. Ms. Capps. Ms. Capps votes aye. Ms. Schakowsky. Ms. Schakowsky votes aye. Mr. Butterfield. Mr. Butterfield votes aye. Ms. Castor. Ms. Castor votes aye. Mr. Sarbanes. Mr. Sarbanes votes aye. Ms. Matsui. Ms. Matsui votes aye. Mr. Lujan. Mr. Lujan votes aye. Mr. Schrader. Mr. Kennedy. Mr. Kennedy votes aye. Mr. Cardenas. Mr. Pallone. Mr. Pallone votes aye. Chairman Pitts.
No.
Chairman Pitts votes no.
Are there other members wishing to record vote? Mr. Guthrie?
You are not currently recorded. Mr. Guthrie votes no.
Are there other members wishing to vote? Not, the clerk will report the vote.
Mr. Chairman, on that vote, there were 11 ayes and 15 nays.
The noes have it. The amendment is not agreed to. Are there other amendments to the amendment in nature of a substitute? The gentlelady from California, Ms. Capps, is recognized to offer an amendment. What number?
Number 21.
Number 25. Clerk will report the amendment.
Amendment to the amendment in the nature of a substitute to H.R. 2646, offered by Ms. Capps.
Without objection, the reading of the amendment is dispensed with. The gentlelady, Ms. Capps, is recognized for 5 minutes in support of her amendment.
Thank you, Mr. Chairman. This amendment would simply incentivize the integration of trauma-informed care into primary care and public health settings. Data show that trauma is a near universal experience of individuals with behavioral health problems. The Office of Women's Health at HHS has found that 55% to 99% of women in substance abuse treatments and 85 to 95% of women in public mental health systems report a history of trauma, with the abuse most commonly having occurred in childhood. And CDC says Center for Disease Control's did a study called the Adverse Childhood Experiences, or ACE. This study found that almost 2/3 of their respondents reported that they had at least one childhood experience of trauma. This could include experiences of physical or sexual abuse, neglect, or family dysfunction. The same study estimated that the economic costs of untreated trauma-related alcohol and drug abuse alone were estimated at $161 billion in the year 2000. This is a real problem that we cannot afford, neither ethically or economically. We can't afford to ignore this problem. Thankfully, trauma is what this amendment will help achieve. Far too often, our primary care and public health settings are the first and sometimes only connection folks struggling with trauma and other behavioral health issues have, so that as they enter the healthcare field. It is not enough to have trauma-informed care and screening at our traditional mental health and substance abuse treatment locations. Instead, and in addition, we need to take a holistic approach to identifying those in need. This amendment would help bridge that gap by supporting efforts in primary care and public health settings to implement a trauma-informed approach by screening individuals and linking them to appropriate follow-up care. If we really want a comprehensive mental health care bill, this is a clear way to help us get there. So I urge my colleagues to vote yes on my amendment, and I will either yield back or yield to someone else. I yield back.
Gentlelady yields back. Is there further discussion? Dr. Murphy, recognized 5 minutes. Strike the last words.
Thank you. One of the great programs, of the 112 programs and agencies that deal with mental health, some of them are questionable, many are redundant, but one of the great ones is the National Child Traumatic Stress Network. It works on trauma-informed care. It works on integrating trauma screening and care within primary care or pediatrics and family medicine. It produces a lot of research, and we currently fund it within the SAMHSA budget to the tune of $46 million a year. And I like continuing that program. So the gentlelady from California is right about this program because it's a great program and we're already doing it. I mean, I think within the National Child Traumatic Stress Network, perhaps if you want, let's dig deeper into that. If they're not doing this, and I think they are, because when I've talked to some members of that agency, they are, but we should perhaps talk to them about directing some of those funds within that. I don't want to pull them out of other things, but we might want to look at that as an alternative to that, because I know with $46 million a year, it's quite a bit, and they have grants, they have funds, they have programs within there. They do programs, they do outreach to physicians, they do product development professionals, families, partnerships with youth and families, education and training approaches, including training practitioners in trauma-informed and evidence-based treatment and services. So, I mean, I believe those things are already being done. But if you think we need a deeper dive, I hope that's one of the things we can continue in terms of hearings to bring them in here and ask them exactly what they do. You'll, gentlelady, if you have a question on that or comment.
I'll wait. I have concerns about what you're saying. Well, let me just
Sure.
identify that what you're talking about children's programs, and the programs that this one is referring to are adults who've had childhood experiences. So it's a different. It's all with the same goal, but it's out of a different program.
Well, I believe those things. I believe that I know that SAMHSA and other programs already work on these things, but nonetheless, I'd be glad to meet with you and others and bring these folks in to ask them just what exactly they do. It's part of the questioning that this committee is in the unique position, especially the subcommittee, to ask questions and have the kind of accountability. Yeah. This is the very issue that the Congressional Budget Office, the General Accounting Office raised in terms of providing information of what they do and how they do it. These programs tend to be some of the ones that collect better data which they can give to us. So I would just ask the gentlelady, hold off on that. Let's dig into this and ask them what they do in these multiple areas.
This is what I'd like to do, vote for the amendment and then continue talking about it.
My only concern is the assignment of some money from this. It's already a tight budget. I'm with you. I'd love to expand considerably the money the federal government puts into these things, and we spend about $130 billion according.
If you notice, the amount for this bill is very small.
Yes, but we're adding.
Minuscule.
Well.
So.
Reclaim my time. I want to make sure that we're continuing the programs that are great value here. We're looking at the reforms within how these funds are spent and work within that, and I hope the committee will have some other hearings on these issues to dig deeper into just how these funds are spent and what happens so we can answer these questions before we direct money to them. And I'll yield back.
Chair thanks the gentleman, and you seek recognition. Chair recognizes the ranking member, Ms. Green.
Has strike the requisite number of words, and I'd like to yield my time to my colleague from Southern California.
I would just simply reiterate that the CDC has some good information. This bill seeks to implement that information, and the experiences of childhood trauma don't go away if they're not accounted for. They get more expensive as time goes on if they aren't. So the amendment stands as it is, and if
I'll yield to you.
Yeah,
okay.
And I'll yield back to you.
Mr. Chairman, I'd like to yield the remainder of my time to our colleague from California, Southern California, Mr. Cardenas.
Thank you, Congressman Green. I'd like to ask Congressman Murphy a question. Can you please clarify? You mentioned that we're already investing $130 billion. Is that in mental health, or is that in health care in general?
This was a report that Ms. DeGette and I requested before. It wasn't GAO. I'm trying to remember what this was. Office of Management and Budget, the executive branch, in terms of how much money is spent in mental health. And they gave us that large number. The majority of that comes from disability payments. There's other programs, including SAMHSA, NIH, and other mental health funding through a wide range of agencies. One of the critically important things within this, if I just take a few more seconds, is that there's a lot of funds out there that are not coordinated together. And that's why we end up with like 26 homeless programs within that. So there's programs out there, and this is where I hope this committee again, with the Assistant Secretary's Office, takes a deeper dive so we can have that information and see what is being done. I'll yield back to the gentleman.
Thank you, Congressman Murphy, for clarifying where that number seems to lie. And I would think that if we're spending $130 billion on mental health right now, just on the mental health itself, I'm a bit confused because I don't see that kind of outplay in the communities across America. Mental health happens to be, in my opinion, perhaps the most underfunded segment of healthcare, and it has been for generations. So 130 billion caught my attention, but thank you for clarifying where that number lies. Thank you.
The gentleman, I can make the specific reference. This was a memo on May 15, 2014, and a memorandum on the Oversight and Investigation Committee. It said OMB reported that in fiscal year 2012, 130 billion in federal funds, of which 13 billion were discretionary, 117 billion were mandatory, were directed to mental health surveillance, research, prevention, treatment, and income support and other social services for individuals with mental illness. Of this, just over 40 billion was paid under Medicare, Medicaid services, 2 billion NIH. The list goes on and on. But you are absolutely right. Does this get down to the level of the individual? Not a lot of it. And this is why I think we have got to, this is within our committee's jurisdiction or Ways and Means. We need to really go through this, put our green eye shades on and say, this has got to get back to states and communities where it's needed. Yield back.
Thank you. I look forward to for all of us doing that. Thank you. I yield back, Mr. Green.
Reclaiming my time. If you're counting Medicare and Medicaid, again, Medicaid, and I have an amendment in a few minutes, is actually the biggest supporter of mental health treatment in the country. And again, that's a large number, but when you think about the Medicaid from all 50 states and Medicare, so that's where that number comes from. That's why it's astronomical, but it doesn't all go to mental health. But, Mr. Chairman, I'll yield back my time.
Mr. Chairman.
Chair thanks the gentleman.
Strike the last word.
The chair recognizes the gentleman, Mr. Pallone. 5 minutes to strike the last words.
I just want to join in this debate about spending on mental health and substance abuse because, Mr. Chairman, in my opinion, all that the bill before us does, that Mr. Murphy's bill does, is move money around. It doesn't really make any major or significant investments in mental health. Since 1986, the share of spending on mental health and substance abuse has fallen from 9.7% of total healthcare expenditures to 6.9% in 2014. The recession of 2008 nearly halved the growth in treatment spending for mental health and substance abuse from approximately 8% growth to 4%. Despite the passage of mental health parity provisions, spending on mental health treatment is projected to increase more slowly than that of other health care between 2009 and 2020. Growth in private spending for behavioral health slowed substantially between the periods of 2004 and 2007 and 2007 and 2009. Private health dollars declined from 7.2% of behavioral health spending to 2.7%. And during this time, Medicaid acted as the safety net. State and local funding declined while federal spending increased mainly via Medicaid. Reduced spending during the economic downturn led to the closure of 2,200 psychiatric beds in state hospitals in 25 states, restrictions on the population served, and the reduction of state mental health authorities' funding of community services in 75% of states. During the economic recession, 3 states cut their mental health budgets by approximately a third, 5 states cut their mental health budgets by greater than a quarter, 10 states cut their mental health budgets by greater than 10%, and 29 states cut their mental health budgets. State mental health spending declined by $4.35 billion between 2009 and 12. 10 states further cut mental health spending in 2015. 11 states kept mental health, provided no increase for 2015. We clearly, Mr. Chairman, have not yet replaced the funding cuts implemented during the recession, and 8.1 million Americans are presently diagnosed with mental illness and are uninsured. So again, obviously we need to make some major investments. That's not what Mr. Murphy's bill does. I yield back.
Chair thanks the gentleman. Is there further discussion on the CAPS amendment? If there's no further discussion, the vote occurs on the amendment. You want a roll call? The clerk will call the roll.
Mr. Guthrie. Mr. Barton. Mr. Barton votes no. Mr. Whitfield.
No.
Mr. Whitfield votes no. Mr. Shimkus. No. Mr. Shimkus votes no. Mr. Murphy? Mr. Murphy votes no. Mr. Burgess? Mrs. Blackburn? Mrs. Blackburn votes no. Mrs. McMorris Rogers? Mr. Lance? Mr. Lance votes no. Mr. Griffith? Mr. Griffith votes no. Mr. Bilirakis? Mr. Bilirakis votes no. Mr. Long? Mr. Long votes no. Mrs. Elmers? Mr. Bouchon? Mr. Bouchon votes no. Mrs. Brooks? Mrs. Brooks votes no. Mr. Collins? Mr. Collins votes no. Chairman Upton? Chairman Upton votes no. Mr. Green?
Aye.
Mr. Green votes aye. Mr. Engel? Mr. Engel votes aye. Ms. Capps? Ms. Capps votes aye. Ms. Schakowsky? Ms. Schakowsky votes aye. Mr. Butterfield? Mr. Butterfield votes aye. Ms. Castor? Ms. Castor votes aye. Mr. Sarbanes? Mr. Sarbanes votes aye. Ms. Matsui? Ms. Matsui votes aye. Mr. Lujan? Mr. Lujan votes aye. Mr. Schrader? Mr. Kennedy? Mr. Kennedy votes aye. Mr. Cardenas? Mr. Cardenas votes aye. Mr. Pallone? Mr. Pallone votes aye. Chairman Pitts?
No.
Chairman Pitts votes no.
Are there members seeking to be recorded? Mr. Guthrie?
Mr. Guthrie votes no.
Dr. Burgess?
Dr. Burgess votes no.
Clerk will report the vote.
Mr. Chairman, on that vote, there were 12 ayes and 16 nays.
All right, the nays have it. The amendment is not agreed to. Are there further amendments?
Chairman,
to
I
the
have an
amendment?
amendment at the desk.
The chair recognizes Mr. Green to offer the amendment. What number?
3. Green number 3.
Clerk will report the amendment.
Amendment to the amendment in the nature of a substitute to H.R. 2646, offered by Mr. Green.
Without objection, the reading of the amendment is dispensed with, and the gentleman, Mr. Green, is recognized 5 minutes in support of his amendment.
Thank you, Mr. Chairman. I'd like to offer this amendment as a sense of Congress that proposed budget cuts in Medicaid harm the ability of states to provide access to critical and timely behavioral health services. Medicaid is the most important source of funding for mental health services. Almost half of all state-controlled funds for mental health services come from Medicaid. This amendment would express the sense that efforts to advance budget cuts to Medicaid program, including attempts to block grant Medicaid, would limit access to behavioral health care services for Americans most in need. These individuals also make up a disproportionate percentage of the people suffering from severe mental illness and substance use disorders. Medicaid is the single largest payer for mental health services in the United States and is increasingly playing a larger role in the reimbursement of substance abuse disorders. Individuals with a behavioral health disorder utilize significant health care services. Nearly 12 million visits made in the U.S. hospital emergency departments in 2013 involved individuals with mental disorder, substance abuse problems, or both. After mental health services simply are not available to many Americans who need help. With fewer than 6 out of 10 Americans living with serious mental illness have no access to mental health care at all. Glaring gaps in treatment of this kind would not be tolerated for heart disease, cancer, or diabetes. They should not be tolerated for mental illnesses either. Efforts to cut or block grant Medicaid deny the opportunity to address this shameful void in access to mental health treatment. Any honest effort to improve mental health and substance abuse treatment must include robust Medicaid funding and coverage expansion. Advocating to gut Medicaid while simultaneously claiming to support improving access to care for mental health and mental illness is frankly disingenuous and ludicrous. This amendment makes it clear that access to care is tantamount to mental health care system, and Medicaid is central to providing that care. Mr. Chairman, and I'd be glad to yield my time for anyone else who would like part of it, or they can get their own. Nope.
Chair yields back.
Yield back.
Further discussion on the Green Amendment. Mr. Shempis, recognized 5 minutes.
Yeah,
for
just to
regular.
speak against the amendment. Many times in the Health Subcommittee, and committees here in Energy and Commerce, I always present the budget wheel. Our discretionary budget is only 1/5 of our total spending. The rest is Medicare, Medicaid, Social Security, interest payments on the debt. Our national debt is really based upon these promises. Medicaid is one of those that is challenged and difficult. We expanded it through Obamacare, and states are 50-50 splits on the cost. So if your state's in financial problems like the state of Illinois is, reform of Medicare to make it cost-effective, to make sure it delivers the services needed to those in need, has to have reform. The statement of block granting as a direct cut is not accurate. A block grant does not mean cut. A block grant does mean that you can incentivize a better use for the dollars. And I think that's what my colleague, Mr. Murphy. So with that, I'd ask people to vote against my colleagues from Texas amendment.
Do you yield to Dr. Bashan, or you yield back? Yield back. Gentleman yields back. Is there further discussion on the amendment?
Mr. Chair,
I'm sorry, I couldn't see your hand. Chair recognizes a gentleman from Massachusetts, 5 minutes, strike last words.
Thank you, Mr. Chairman. I'm with the strike the last word. Mr. Chairman, we've heard testimony and comments from both sides of the aisle about the importance of trying to make this bill move, about the urgency, about the impacts that are happening, of the lack of access to mental health care, the lack of access and investment in mental health care. Congressman Murphy has been eloquent and articulate about the impact of waiting yet another moment to allow this bill to linger, which is why it is a bit tough to stomach making not to allow people that are poor or in rural areas to access mental health care. So that can be a decision that this body should make, but make no mistake about it, when we say we can't do it, that is because we are choosing not to do it. And I think you're hearing some frustration from me and from other members on this committee, because we do have the power to actually make that decision and to allocate those choices, and to understand that when 55% of counties in this country, as I've already said, have no practicing psychiatrists, psychologists, or social workers, we can do something about that. And I think Mr. Murphy's bill can be a big step in that direction, but we still have to make, in my mind, an investment in that continuum of care, which I think Mr. Murphy, and in my conversations with him, have pledged to at least try to discuss and see how we can make that happen. But to say that there's a fierce urgency to take this on, and then just say, hey, when we actually look at the numbers on it, we just can't afford to pay for it, or we need a CBO score, that is a choice, and we need to understand that. Now, I'll yield to Mr. Pallone if he still wants the time.
I just wanted to comment on Mr. Shimkus's analysis with this block grant. You know, he said, oh, block grants doesn't necessarily mean we're going to have less money. Well, of course it does. The reality is that Medicaid is a safety net. You know, I talked about the problem during the recession. Well, you know, when you have a recession or an economic downturn, the number of people that need Medicaid because they lose their job or whatever goes up. And you have to be flexible with it so that if more people need Medicaid, more money becomes available. If you have a block grant, it becomes rigid, and you have a downturn, or you have more people that need Medicaid, the money simply isn't there. So this notion that somehow the block grant doesn't provide less money, it's rigid. That's the problem with it. And the money won't be there if there's a greater need for Medicaid. I mean, that's the reality. I yield back to the gentleman.
I yield to Mr. Green.
I thank my colleague from Massachusetts for yielding to me. Having served 20 years in the state legislature, I understand what states want block grants, because that gives them the authority to spend the money without any oversight. If we block grant Medicaid to all the states, then the state legislators make that decision. I always assume that whoever has to tax somebody for the money ought to be able to decide where it goes. And I'm not willing to do that as a member of Congress. And I know as a state legislator, I'd love when I got money from Washington because we could spend it for whatever we want. Either of our substitutes does not do any good unless we pay for it. And that's why this sense of Congress, even Congressman Griffin, who practiced law like I did, when I had a client that was mentally ill, 30 years old, they probably didn't work enough to get Social Security disability. Medicaid was the only way they got health care, except through our public hospital system, and they needed Medicaid reimbursement. Medicare and Medicaid reimbursement in Texas is typically 66% federal money, the rest state money. And again, we're the ones providing the bulk of it. That's why block granting shouldn't work. If we're going to tax our constituents for it, we ought to at least know where it's going and say, oh, I transferred that to the state folks to do it. That's not always correct because we're the one having to ask for that money. And again, I thank my colleague for yielding to me, and I urge adoption of this resolution, this amendment.
Mr. Chairman, I move to strike the last word.
As the gentleman
Yes.
yield back?
Yes, Mr. Chairman.
All right, we go to this side. The chair recognizes the gentlelady, vice chair of the committee, Ms. Blackburn, 5 minutes.
Thank you, Mr. Chairman. I appreciate that. I think one of the things that is getting lost in this discussion is this is not federal government money. This is taxpayer money. And I'm listening to my colleagues across the aisle, and they are wanting more government control, federal government control, and they are wanting the status quo. Let's keep Medicaid like it is, and let's not try something different like Dr. Murphy is proposing that is actually going to get services to people that need the services. If you keep doing things the way they are, everybody talks about Medicaid is broken and Medicaid needs to be fixed and Medicaid needs to be reformed, but don't do it. And now we have a to do. I am so disappointed in this amendment. It is an attempt to score cheap political points, and you know it. And you know it. And the discussion of how to provide mental health services for people in need, it should be above that kind of cheap political point scoring. So it is disappointing that you see this type of amendment that is here. Now, I think one of the things that is important to do is to realize, as Mr. Shimkus was saying, where our money goes, where taxpayer dollars go through the federal government. We are borrowing a lot of what we spend, and it is time that we get that fiscal house in order. Because if you run out of money, nobody is going to win. So this amendment that is a sense of Congress and blaming GOP budget cuts to Medicaid services and saying that that harms the state is ill-founded, it is ill-placed, and the discussion of how to provide mental health services, how to reform SAMHSA, how to make this work is a better discussion. It is a topic that deserves a better approach than what you are giving in an amendment to place blame and say it is because of this, that, or the other. I think that this is, you all can do better than this, and it's disappointing, and I yield back.
Will the gentlewoman yield?
Yes, I do yield.
I just want to confess to the committee that I must have an ill-founded and ill-placed perspective, because I actually believe what this says. That the Republican proposed budget cuts
Reclaiming my time.
harm the ability.
Reclaiming my time. Mr. Chairman, I yield to Mr. Bouchon the balance of my time.
Thank you, Mr. Chairman. I'm glad the Democrat staff think this is funny, because this isn't funny. This is about trying to reform the mental health programs to make it work for patients, real people. It's not about cheap political points, which I want to associate myself with Ms. Blackburn's statement on that. But traditional Medicaid's not good insurance. Traditional Medicaid is not good insurance. I was a practicing doctor for 15 years. I can tell you that's the case. Indiana has chosen a different course. We've gone with Healthy Indiana Plan 2.0, an HSA-based way, state-based way, to cover low-income citizens. And there's over a 90% of approval rating from the participants. And it's saving the state money and therefore saving the federal government money. It also reimburses providers at a higher level, so it encourages providers to actually see these patients, which traditional Medicaid does not. And I also disagree with the characterization that a block grant to the states, allowing states like Indiana to create state-based programs like Healthy Indiana Plan 2.0, is a cut to the Medicaid program. That's just a mischaracterization, and I do think this is a politically motivated amendment, which I think is unfortunate. And I'm hopeful we can get back to a discussion about how we take care of people. I yield back.
Chairman yields back. Now recognize the ranking Mr. Malone, 5 minutes for strike the last words.
Thank you, Mr. Chairman. Look, I don't think it's a cheap trick to try to talk about maintaining Medicaid coverage, or actually what we do in the ACA by expanding the Medicaid program, because, look, let's face it, Medicaid coverage is generally more comprehensive than private health plans. It covers psychiatric hospital visits, case management, psychiatric evaluations and testing, psychosocial rehab, individual, group, and family therapy, and the list goes on. So the bottom line is that Medicaid is providing these services for the most vulnerable people in our society. And if they don't get Medicaid, they're probably not going to get this kind of comprehensive coverage. So to say that it's a cheap trick is, in my opinion, absurd. It's just the opposite. We're very concerned about the fact that this vulnerable population is not getting coverage and is not getting comprehensive coverage. And I would maintain that the best way to do that is by not only maintaining Medicaid and not cutting it back, which is what a block grant usually does, but by expanding it. And we've expanded Medicaid as a result of the ACA. As many as 32 million individuals are on track to gain access to behavioral health coverage for the first time by 2020. And I just find it that we're very disappointing that at the same time we're debating proposal to address the mental health crisis facing so many people in this country, that my colleagues on the other side of the aisle have supported budget proposals that would drastically cut the very program that holds the most promise to help keep the most vulnerable in our society protected. The budget adopted in March by the House would repeal the Affordable Care Act, including the Medicaid expansion. It would reduce funding for the Medicaid program by an estimated $500 billion over 10 years. This would be as a result of converting the Medicaid and the S-CHIP program to a block grant, a combined reduction of $913 billion over 10 years. So how can you say that there isn't going to be less money in a block grant? Of course there is. That's the very purpose of it. The Congressional Budget Office has concluded that the states having to take steps such as cutting eligibility in health services, reducing already low payments to health care providers, and these changes would not only result in millions of low-income individuals losing medical assistance under Medicaid, but would also result in a loss of coverage of behavioral health services, which are optional under federal law. And it's for these reasons that I urge my colleagues to support the amendment from the ranking member, Mr. Green, that would reiterate the concern that these proposed budget cuts to Medicaid would add tens of millions of low-income individuals to the numbers of those uninsured, limit access to critical behavioral health services, and instead, Congress should focus efforts on improving and expanding Medicaid. Now, I know you don't like to talk about this because it goes against what you say you're trying to achieve, but the fact of the matter is that if you start cutting Medicaid, you block grant it, you allow, states already don't have to expand it, the consequences that are dire for people who are trying to get mental health services. There's no way around that. You can't convince me otherwise. The proof is based on, what we're getting from CBO and other nonpartisan sources. I don't know if anybody wants my time. Yes, Mr. Sarbanes.
Well, I just want to associate myself with the comments of Mr. Pallone and also with Mr. Kennedy, who mentioned a moment ago that this is about choices that we're making when it comes to resources. I think it's absolutely fair and appropriate to identify that the proposed budget cuts to the Medicaid program that have come from the Republican majority in this House would undermine the very kinds of resources that we've devoted hours of discussion to today. And if we're not going to invest in the resources that make these kinds of measures meaningful and substantive and that really address this crisis of mental health disease and suffering and trauma across the country, then in the end, a lot of what's happening here ends up being a cruel trick on those people that we're really trying to help. So I think this is a fair characterization of what's happened here in the House of Representatives, and I don't think it's a cheap political trick in any way, and I yield back.
I only have 15. You want it?
15 seconds.
You're going to get your own time?
Gentleman yields back. Is there further discussion on the Green Amendment? Mr. Cardenas, you're recognized for 5 minutes. Strike the last word.
Thank you, Mr. Chairman. Before I yield my time to my colleague, Mr. Green, I'd like to demonstrate to the people who are taking their important time to listen to these dialogues of your elected officials. I have 2 coins in my hands. They're in my hands. The money that is sent to Washington is in the hands of Congress. Congress controls the purse. But when Congress says, we have money, and they get rid of most of it, or half of it, or some of it, and then they go to you and say, now we don't have enough money to fund mental health programs, that is disingenuous, and it's something that you all need to pay attention to. Because we're not talking about lazy, good-for-nothing people who need mental health services. We're talking about American families. We're talking about middle-class families. We're talking about families who just can't afford what it takes to take care of their loved ones and make sure that they're safe and their families are safe and the community's safe. So that's what's going on here. When you hear members of Congress saying that we don't have money, yet at the same time, the same exact time, the same day, they're on other committees wanting to cut the budget, wanting to cut the revenue of the federal government, just to say that we don't have enough money. Not anyone else. It's Congress. So when Congress reduces the amount of resources that they have to put into good, wonderful programs to serve the American public, to serve American families, when they cut that and the next day or that same day they say that the money's not there, that's disingenuous. I'd like to yield the rest of my time to my colleague, Mr. Green.
Thank my colleague from Southern California for yielding. First of all, if you remember my remarks, we cut $4.35 billion in public mental health programs from 2009 to 12. 2009 and 10, Democrats were in charge. So it's not just on the Republicans, but, and this is not a cheap trick. $4 billion is not cheap. But that's what we've had to deal with. And for my colleague from Indiana, I admire Indiana for your expansion. You get 90% approval Medicaid. Believe me, we couldn't get that in Texas. And but again, we transferred that to Indiana, and I appreciate that. I would hope I've been trying to work with Texas to do some of the same things that other states have done. And but again, this is what we're talking about. We can pass any legislation through this committee we want, but it doesn't do us any good if we don't have folks that can get the coverage to do it. And that's why Medicaid is so important. And again, that's why I want to do mental health reform, but I also want to make sure it's done correctly and that we have that services. And I'll tell, all of us have a lot of stories. I remember practicing law, I had a justice of the peace one time that I was representing on a mental health docket. This person was so obviously so ill. And the justice of the peace started lecturing about needing to get a job and go to work. And I objected, saying, you know, you can tell this person is so ill. You know, that doesn't do any good to somebody who's mentally ill to tell them to get a job and go to work. They need treatment, and then maybe they can go to work and be useful. But the treatment is not cheap. And I want to thank my colleague, and I yield to my colleague from California, Congressman Capps.
Just to underscore, and I thank my colleague for yielding to the comments made by my colleague from Massachusetts, that we do have choices, and also Mr. Cardenas, that this is a matter of choice. We do have the resources, and we can make choices. And when my sheriff and my police chief come to me and say, I have the largest mental health facility in your town, in our town, and when the school study teams, public schools, have kid that they know acting out, needs help, and they say, tell me, there's no place, to send them. And you know that that child is not going to stay a child forever. And those problems, untreated, are not going to go away. So we have choices. And we can be cutting the services that we know we need, or we can say we're going to find a way to do this. And this is the time that we should do it. So I appreciate the opportunity to say that, and I yield back. Mr. Cardenas.
Chair, thanks the gentleman. Is there further discussion on the Green amendment? Judge Butterfield's recognized 5 minutes, strike last words.
Thank you, Mr. Chairman. I won't take the full 5 minutes, but I must go on record, Mr. Chairman, in responding to the gentlelady from Tennessee. I know the hour is late, but I just cannot allow her statement that this is a cheap political shot to go unanswered. 1/3 of the people that I represent in North Carolina fall below the poverty level. And so to say that this is a cheap shot because we're willing to take the time and to take the energy to talk about poor people and their entitlement to health care is unnecessary. And so I want to take exception to her statement. You know, the truth hurts sometimes. And the fact of the matter is that the Republican Party has cut funding for Medicaid. Since you have been in the majority, you have had a concerted effort in each one of your budgets to cut funding for Medicaid. You have deliberately tried to block grant Medicaid and to take the authority away from this Congress. As Mr. Cardenas says, this is our prerogative to fund the Medicaid program, not the state's prerogative. But to give the Medicaid program to the states without any guidance will go in the direction that we don't want it to go. Mr. Pallone is right. When you give money to the states, it becomes very rigid, and they can do what they want to do with the money. And at the end of the day, the ones who lose are the recipients, are the patients. And you know what happens at the state level when there's a shortage of money for funding. They cut eligibility, which could lead to more uninsured, low-income people. They can cut covered health services, which would lead to more uninsured, low-income people. And they can also cut rates for the providers that provide these services. And so I just could not go home tonight and think about this proceeding today without going on record saying that this is not a political ploy. This is about trying to help poor people in the United States of America. Thank you.
Could my friend give me just a few seconds?
I'll yield, yes.
Thank you, Mr. Butterfield. I want to bring us back to our purpose here, and we're bringing up great points, and I appreciate that. I want to recall that Dr. Tom Insel, the director of the National Institute of Mental Health, said that mental illness costs the country at least $444 billion a year. Only about a third goes to medical care. The bulk of the cost to society stems from disability payments, lost productivity. This doesn't include lost wages from caregivers who are taking care of the mentally ill, and it doesn't include the tax dollars spent in prison. This is one of those areas where the states don't get it yet. And I'd love to work on some wording in this in the major bill between now and the main committee, that 80% of the mentally ill in prison don't get any treatment. There's 350,000 people in our prisons who are mentally ill. California alone has 30,000 seriously mentally ill in prison. And without treatment, they end up going right back in. When they have treatment in and outside, the recidivism rate really plummets. A study in Arkansas that the legislature had, which looked at multiple states, that the cost of incarceration of the seriously mentally ill is 20 times more than outpatient care. And a person with serious mental illness is 10 times more likely to be in prison than a psychiatric hospital. So these are areas that I agree with you. We ought to be providing some guidance to states and doing some of these things, and I think it would help immensely.
Reclaiming my time.
Yes.
Thank you very much for those words, Dr. Murphy, and I look forward to working with you on this because our indigent population is being overlooked. Your state was a progressive state. You did the right thing. You expanded the Medicaid program. Many of our southern states did not expand Medicaid, but we've got to work with our states and try to really drive home the point that unless we provide care for low-income individuals, our communities are not going to be strong. Thank you. I yield back.
Chair, thanks, gentlemen. Is there further discussion on the Green amendment? Seeing none, the vote occurs on the amendment. You want a roll call?
Roll call.
The clerk will call the roll.
Mr. Guthrie? No. Mr. Guthrie votes no. Mr. Barton? Mr. Barton votes no. Mr. Whitfield. Mr. Whitfield votes no. Mr. Shimkus. Mr. Shimkus votes no. Mr. Murphy. Mr. Murphy votes no. Mr. Burgess. Mr. Burgess votes no. Mrs. Blackburn. Mrs. Blackburn votes no. Mrs. McMorris Rogers. Mr. Land votes no. Mr. Long. Mr. Long votes no. Mrs. Elmers. Mr. Bouchon. Mr. Bouchon votes no. Mrs. Brooks. Mrs. Brooks votes no. Mr. Collins. Mr. Collins votes no. Chairman Upton. Chairman Upton votes no. Mr. Green.
Green.
Aye.
Mr. Green votes aye. Mr. Engel. Mr. Engel votes aye. Ms. Capps. Ms. Capps votes aye. Ms. Schakowsky. Ms. Schakowsky votes aye. Mr. Butterfield. Mr. Butterfield votes aye. Ms. Castor. Ms. Castor votes aye. Mr. Sarbanes. Mr. Sarbanes votes aye. Ms. Matsui. Ms. Matsui votes aye. Mr. Lujan. Mr. Lujan votes aye. Mr. Schrader. Mr. Schrader votes aye. Mr. Kennedy. Mr. Kennedy votes aye. Mr. Cardenas. Mr. Cardenas votes aye. Mr. Pallone. Mr. Pallone votes aye. Chairman Pitts.
No.
Chairman Pitts votes no.
Are there other members seeking a recorded vote? If not, the clerk will report the vote.
Mr. Chairman, on that vote, there were 13 ayes and 16 nays.
The nays have it. The amendment is not agreed to. Are there further amendments to the amendment
Mr.
in the nature of
Chairman,
a substitute?
I have an amendment.
Mr. Pallone is recognized to offer an amendment.
It's number 23, I believe, on PAYMEs.
You have that?
Am I?
20.
Oh, you want to go first?
What's the number again?
Number 23.
23.
Amendment to the amendment in the nature of a substitute.
Amendment.
Thank you, Mr. Chairman. We're here today because our mental health system is broken, yet it's not beyond repair. We're here today because we all believe that our mental health system is in desperate need of modernization. It clearly falls short of meeting the needs of the 21st century patient with mental illness. However, we need to be sure that in an effort to reform, we fix what is broken but maintain what works. And with that in mind, I'd like to put forth an amendment to preserve the rights of PAYMEs to protect the rights of the mentally ill. Our patients with psychiatric illness have faced a long history of stigma, discrimination, and maltreatment in this country. The conditions of the asylums of the last century were downright deplorable. After deinstitutionalization, sadly, attitudes did not change overnight. In response, Congress acted to create the Protection and Advocacy for Individuals with Mental Illness System. Since 1986, PAYME has instituted protection and advocacy systems, PAs, in every state. In 2012 alone, P&As addressed 12,968 complaints concerning abuse, neglect, and maltreatment. In doing so, the system advocated for 24 million individuals to provide protections for our most vulnerable patients. And simply put, this system is an invaluable lifeline for many of our patients who may otherwise be left voiceless. Unfortunately, the bill today would have a devastating impact on the PAYME program. In an attempt to limit PAYME from performing activities beyond abuse and neglect, this legislation guts the critical tools P&As use to protect patients. It removes the ability of the mentally ill to receive representation if they are discriminated against in housing or in workplace, and it takes away an ally if a patient disagrees with a medication plan put forth by a caregiver. The advocates of this measure have claimed that PAYMEs are part of the anti-psychiatry movement, and this couldn't be further from the truth. I also find it troubling to put forward the notion that a competent individual with mental illness does not deserve the rights to make decisions in their own treatment. Treatment decisions for patients with mental illness are incredibly complex. The medication used for patients with schizophrenia or bipolar come with common side effects such as weight gain, high cholesterol, and difficulty sleeping. On top of this are less common but well-known serious reactions such as abnormal heart rates and other life-threatening conditions. The idea that a competent patient would be left without an ally to participate in shared decision-making over proper medication use is unfathomable to me. The use of PAYMEs has been an invaluable resource to protect the safety and rights of some of our most vulnerable patients, and I implore the committee to resist the urge to turn back the clock on mental illness and preserve patient access to protection and advocacy. I yield back the remainder of my time, Mr. Chairman.
Chair, thanks the gentleman. Is there further discussion on the plan? Dr. Murphy, recognized 5 minutes. Back to last word.
Thank you, Mr. Chairman. This is a very important part of reform of our mental health system. PAMI was originally developed to make sure that they were stopping the abuse and neglect, as my friend Mr. Plone pointed out, that was horrid and rampant in many asylums, and actually continues in many prisons. I'm grateful that the PAMI organization in Pennsylvania stood up to try and stop some of these horrible practices in the prison system. We still don't have treatment in prisons in many states. But for example, this is where they found that prisoners who were seriously mentally ill were often tased, put in solitary confinement for 23 hours a day, which is the worst thing you can do for someone with schizophrenia and other illnesses. Those are good things they do. But our concern is they do very little to ensure that those who need access to hospitalization or treatment get it. The focus is almost exclusively on getting people free of treatment rather than into it. Extensive PAMI research are going also to fight alternatives to institutionalization and alternatives to jails. They also have resources are going to force states to close psychiatric hospitals in spite of the fact that we do not have enough beds for those who are seriously mentally ill and in crisis states. This is also a lot to do with because SAMHSA was not providing oversight and reviewing what they do. This section of the bill is, and other sections here dealing with this, is to get is to get PAMI back on track to what we want them to do. Focus on abuse, focus on neglect, make sure that they are working on a wide range of protecting the rights of the mentally ill to get treatment, to get housing, to get supportive education, supportive employment, all of those issues there. This is what we want them to get refocused on because that focus has gone astray. And in so doing, this is where the story we had in testimony on our Oversight Committee from a guy named Joe Bruce, who talked about his son Will, who was in a psychiatric hospital in the state of Maine. His son was 20-something at the time, and a psychiatrist on the case said, Will is dangerous. That psychiatrist was off the case. There was another psychiatrist that came on the case and says, Will is a dangerous person, don't let him out. He was also removed from the case. To harm anybody. And that person, according to the hospital notes, turned towards him and coached him and said, tell him you're not going to harm anybody. So he said, I'm not going to hurt anybody. He was then asked, are you going to hurt yourself? The hospital notes said that he was then coached to say, I'm not going to hurt myself. So the courts then said, we can't keep him here. They let him out. They didn't assure he had treatment afterwards. He went home. He took an axe and he chopped his mother to pieces, believing she was part of Al-Qaeda, and he was commanded to kill her. This is not the function of this organization that we want. We want them focused on protection and advocacy to make sure abuse is not occurring to them in treatment or out of treatment. But when they stop treatment, that's a serious problem that we all ought to be engaged in. I want them focused on their original mission. I don't know who within this is responsible or is taking responsibility. That's why part of this also says that there should be a grievance procedure. And actually, some people we've talked with, the protection and advocacy organizations, helped us craft some of that wording. So this is very concerning that I think they've lost their course. We want to get them back on course. And that's why this part is in the bill, and that's why I believe this part needs to remain in the bill. And I yield back.
Chair, thanks, gentlemen. Is there further discussion on the Plone amendment? The gentleman is recognized. 5 minutes. Strike last words.
Thank you, Mr. Lujan. It really disturbs me to hear what Mr. Murphy says. I mean, this is the same argument that I've heard over and over again from the Republican Party with regard to legal services, legal aid societies. You know, they always want to cut back on those who would represent the vulnerable, the poor. The Pay Me program was created to address evidence of pervasive abuse, neglect, discrimination against the mentally ill. And, you know, the program basically protects people's rights to live and work in an integrated setting, to receive Medicaid services, the right to vote. I understand that you want to limit it, but by limiting it, you're limiting protection and the civil rights of the mentally ill. They're the largest provider of legal advocacy for Americans with mental illnesses. Beyond legal advocacy addressing abuse and neglect, the program connects mentally ill individuals to several other important services. It links thousands each year to crisis services, assertive community treatment, case management services, and supported employment. The advocates have helped children with mental illness get the services they need to succeed in school, and adults with mental illness obtain. Care providers helped a 30-year-old man who had been institutionalized the majority of his life to develop a discharge plan and transition into community treatment. And the man was able to successfully live in the community because of the support that Pay Me advocates provided. Now, H.R. 2646, Mr. Murphy's bill, prohibits the Pay Me program from performing any activities beyond work addressing abuse and neglect. This prevents the Pay Me program from protecting individuals with mental illness from other violations of their rights, such as housing discrimination. The legislation would prohibit P&A from counseling an individual with a serious mental illness on the right to refuse medical treatment and from acting against the wishes of the caregiver of an individual with severe mental illness. I think you are being honest in saying, Mr. Murphy, that you want to severely restrict Pay Me in what they do, but that's the problem. I think there's a basic difference here between whether or not Pay Me is going to have this broad range of rights to protect those who have mental illness, or is going to be restricted to just certain things. And I think that by restricting the program, you are making it very difficult for those who are mentally ill to get the kind of help that they need. Now, I know that Republicans historically don't like legal aid. They don't like legal assistance for the vulnerable and the poor. I guess they just don't like lawyers, probably, is what it really comes down to. But the fact of the matter is that the Pay Me program and the legal advocates that are part of it are doing very important things. And if you really care about the mentally ill, you wouldn't try to restrict it in this fashion. It's going to really make it much more difficult for those who have mental illness or behavioral problems to assert their rights in every arena. And that's why it's wrong to restrict it. I thank the gentleman for the time.
Gentleman yields back. Is there further discussion on the Pallone amendment? If not, if there's no further discussion, the vote occurs on the amendment.
I'd ask for a roll call, Mr. Chairman.
The clerk will call the roll.
Mr. Guthrie? No. Mr. Guthrie votes no. Mr. Barton? Mr. Whitfield? Mr. Shimkus? No. Mr. Burgess votes no. Mrs. Blackburn? Mrs. Blackburn votes no. Mrs. McMorris Rogers? Mr. Lance? Mr. Lance votes no. Mr. Griffith? Mr. Griffith votes no. Mr. Bilirakis? Mr. Bilirakis votes no. Mr. Long? Mr. Long votes no. Mrs. Elmers? Mr. Bouchon? Mr. Bouchon votes no. Mrs. Brooks? Mrs. Brooks votes no. Mr. Collins? Mr. Collins votes no. Chairman Upton? Chairman Upton votes no. Mr. Green?
Aye.
Mr. Green votes aye. Mr. Engel? Aye. Mr. Engel votes aye. Ms. Capps? Aye. Ms. Capps votes aye. Ms. Schakowsky? Aye. Ms. Schakowsky votes aye. Mr. Butterfield? Aye. Mr. Butterfield votes aye. Ms. Castor? Ms. Castor votes aye. Mr. Sarbanes? Mr. Sarbanes votes aye. Ms. Matsui? Ms. Matsui votes aye. Mr. Lujan? Mr. Lujan votes aye. Mr. Schrader? Mr. Schrader votes aye. Mr. Kennedy? Mr. Kennedy votes aye. Mr. Cardenas? Mr. Cardenas votes aye. Mr. Pallone? Mr. Pallone votes aye. Chairman Pitts?
No.
Chairman Pitts votes no.
Are there further recorded? Mr. Whitfield?
No. Mr. Whitfield votes no.
Mr. Barton?
No. Mr. Barton votes no.
The clerk will report the vote.
Mr. Chairman, on that vote, there were 13 ayes and 16 nays.
The nays have it. The amendment is not agreed to.
Mr. Chairman?
Mr. Chairman,
Who's seeking
if
recognition?
I might just strike the last word, if I might have a
The chairman of the full committee.
little colloquy, perhaps with Mr. Pallone or Mr. Green. We've been here a long time this morning, since this morning. I know as we look at the amendments, our side is we're prepared to accept the Butterfield Minority Fellowship amendment as part of this amendment in the nature of a substitute. I'm just curious to know how long, we're going to have votes on the House floor soon, 5-10 minutes, a series of votes. I think there'll be perhaps another series later on. Should we be telling members to come back after the series of votes on the floor? I think our side, other than the one Butterfield amendment, is likely to be prepared to vote no on the amendments. And it's, as I said earlier, it's important that we get to first base. This is the subcommittee mark. I'm sure that a lot of discussions will go forward before we determine on when we go to full committee. I'm just doing a temperature check.
Mr. Pallone?
Look, I appreciate your comments, but look, the fact of the matter is that we're not happy on our side of the aisle with the way we got to this markup, because we feel that the negotiations were broken off, which when they should have continued. It was clear that our concerns were not being heard, and that's why we have these series of amendments, because we want to get them on record and we want people to understand the problems that we have with the Murphy bill and what we would like to see changed and added to the Murphy bill in order to make it truly bipartisan. We have approximately 15 more amendments that we're going to go through here. Since we're voting anyway tonight into the wee hours, I don't think it matters that we come back. So at this point, we are prepared to move forward with the 15 amendments. I don't, it's not like we're going to be here anyway, so I don't think it really matters.
We may or may not be. I mean, the floor may decide, the House floor may decide just to roll the amendments on the floor and have those votes until tomorrow.
Well, why don't we wait and see what develops, and let's proceed so that we can get on the record our concerns, and hopefully over the next 2 or 3 weeks or whenever the full committee markup takes place, there'll be an effort, which you seem to want to do, to negotiate with us and go back to the drawing board and address these democratic concerns. But for now, I suggest we just continue. We have about 15 amendments.
I just want to say a couple weeks ago, I sat down with a number of groups, the National Alliance on Mental Health, on mental illness, American Psychiatric Association, the Mental Health America, National Council for Behavioral Health, National Alliance on Mental Illness, American Psychiatric Association, Mental Health America, chairman, presidents, medical directors. I asked all of them if they had amendments or thoughts as to how we could improve the bill. All of them said we support the bill as it is.
I know that Mr. Murphy and now you continue to insist that Mr. Murphy's bill is nirvana, that everyone
I didn't say it was perfect. But
everyone
I'd
loves
like
it,
to get
and all
to
the newspapers love it, and that's all very nice that you've all been out there promoting Mr. Murphy's bill. The reality is that there are a lot of people that don't like it. I think that's been made quite clear with our amendments and our substitute today. In fact, if you'd like, I've been trying to be a little nice here. I will enter into the record, I'll ask unanimous consent to enter into the record letters from various organizations who have major problems with the bill. And I'd ask at this time to enter into the record a letter from this Consortium for Citizens with Disabilities, the National Disability Rights Network, the International Society for Ethical Psychiatry and Psychology, the Civil Rights Coalition on Police Reform, the HIV Healthcare Access Working Group, the National Women's Law Center, the American Civil Liberties Union, you should read that one, the National Disabilities Leadership Alliance, Easter Seals, you know them, the Substance Abuse Community, I don't know, there's about 15 groups on that letter, and this one is from, where's this one from?
All right, well, my time has expired. I
without-
can see the
without
vote being
objection-
I ask that we could,
yield
if-
back and,
Mr. Chairman, I ask unanimous
forward.
consent to introduce those letters.
Without objection,
Thank you,
so
Mr. Chair.
ordered. Are there other amendments to the amendment nature of substitute?
Mr. Chairman, I
By
have
the
an
way, we
amendment,
are
yes.
voting on the floor. We have 13 minutes left. Who seeks recognition?
Chairman?
The chair recognizes Mr. Lujan to offer an amendment. What's the number?
Amendment 22.
Clerk will report the amendment.
Amendment to the amendment in the nature of a substitute to H.R. 2646, offered by Mr. Lujan.
Without objection, the reading of the amendment is dispensed with. The gentleman, Mr. Lujan, is recognized 5 minutes in support of his amendment.
Mr. Chairman, this amendment seeks to grow the peer professional workforce. It establishes a SAMHSA grant program to develop and sustain behavioral health, paraprofessional training, and education programs, and provides tuition support. This amendment would increase the number of behavioral health paraprofessionals, such as trained peers, recovery coaches, mental health and addiction specialists, prevention specialists, and addiction counselors, and help communities develop the infrastructure to train and certify peers as behavioral health professionals. People in recovery from behavioral health disorders and their family members are being trained as specialists and are contributing to the field in a variety of roles, including as health educators, patient navigators, and outreach and engagement workers. These evidence-based recovery supports have strengthened the workforce and expanded access to effective services. The real-world experiences of peer professionals bolster workforce expertise and guarantee inclusion at all levels of the delivery system. In my home state of New Mexico, the integration of peer professionals and behavioral health paraprofessionals are welcome additions due to our workforce shortage, especially in our rural communities. I urge my colleagues to support this amendment. Yield back the balance of my time.
Chair, thanks, gentlemen. Is there any discussion on the amendment? Dr. Murphy, you recognize 5 minutes.
Thank you, Mr. Chairman. I just want to point, this is addressed in the bill. At the beginning, it says that the Assistant Secretary's job, one of the things will be to discuss, to bring a report to Congress of a nationwide strategy of how to deal with workforce shortages and directions for psychiatrists, psychologists, psychiatric nurse practitioners, clinical social workers, mental health peer support specialists. It is in the bill. It is addressed to provide those things, and so along those lines, I'd say that let's stick with the base bill. I yield back.
Is there further discussion on Lujan amendment? Ms. Matsui is
Yes,
recognized
strike
5
last
minutes. Strike
word.
last words.
I'd like to yield to Mr. Lujan.
Mr. Chairman, thank you very much, Ms. Matsui. And Mr. Murphy, while I appreciate that there's language in the legislation that is close to what I'm suggesting here, there's no money to do it. If Ms. Matsui would yield.
Yes, I yield.
Thank you. The money comes within the budget of that agency to do that. It's part of the reports. Currently, Congress does get some reports on things like suicide rates. We don't get very accurate reports on some other things, but we never really asked an agency to provide us a widespread information within this to gather that information from the states to do a nationwide study. So it's in here, and I believe the funding is already in there to handle that too. I'm with you. We don't have this kind of data. We have seen reports come from some universities in terms of what they think peer supports, clinical peer supports versus other peer support. It is a valuable service. I agree with you. We need more. And this is where I believe it's already addressed in the base bill.
If Ms. Matsui would yield.
I yield again to Ms. Lujan.
Mr. Murphy, I appreciate the value of the reports. Well, what this amendment does is it's a grant program for these peer professionals to do the work. And there's no money for that. And that's why this amendment's important. It's working in New Mexico. I think when we visit with all of our constituents, everyone that we're fighting for, they can attest to us the importance of the value of the peer support specialists. And that's what I'm just trying to get to here is there needs to be some investment behind this as opposed to just Congress asking for a report to come back to tell us that this works and that it's good. We know that it's working. We know that it's good. Let's put some money behind it and invest in making sure that all of the people we're trying to help also have access to peer support specialists. That's all that I'm trying to say. And with that, I yield back to Ms. Matsui.
And I yield back.
Chair, thanks, gentlelady. Is there further discussion on the Lujan amendment? If not, the vote occurs on the amendment. You want a roll call? The clerk will call the roll.
Mr. Guthrie? No. Mr. Guthrie votes no. Mr. Barton? Mr. Whitfield. Mr. Shimkus. No. Mr. Shimkus votes no. Mr. Murphy. Mr. Murphy votes no. Mr. Burgess. Mrs. Blackburn. Mrs. Blackburn votes no. Mrs. McMorris Rogers. Mr. Lance. Mr. Lance votes no. Mr. Griffith. Mr. Griffith votes no. Mr. Bilirakis. Mr. Bilirakis votes no. Mr. Long. Mr. Long votes no. Mrs. Elmers. Mr. Bouchon. Mr. Bouchon votes no. Mrs. Brooks. Mrs. Brooks votes no. Mr. Collins. Mr. Collins votes no. Chairman Upton. Chairman Upton votes no. Mr. Green.
Aye.
Mr. Green votes aye. Mr. Engel. Mr. Engel votes aye. Ms. Capps. Ms. Capps votes aye. Ms. Schakowsky. Ms. Schakowsky votes aye. Mr. Butterfield. Mr. Butterfield votes aye. Ms. Castor. Ms. Castor votes aye. Mr. Sarbanes. Mr. Sarbanes votes aye. Ms. Matsui. Ms. Matsui votes aye. Mr. Lujan. Mr. Lujan votes aye. Mr. Schrader. Mr. Schrader votes no. Mr. Kennedy. Mr. Kennedy votes aye. Mr. Cardenas. Mr. Cardenas votes aye. Mr. Pallone. Mr. Pallone votes aye. Chairman Pitts.
No.
Chairman Pitts votes no.
Are there other members seeking recorded vote? If not, the clerk will report the vote. Four- 14.
Mr. Chairman, on that vote, there were 12 ayes and 14 nays.
The nays have it. The amendment is not agreed to. We still have 7 minutes on the clock. The subcommittee will stand in recess till immediately following the vote series. We'll reconvene. All right, the time for recess having expired, we will reconvene. We're still on the amendment in a nature of substitute. Are there further amendments to the amendment in nature of a substitute?
Mr. Chairman, I have an amendment at the desk.
What number?
50.
All right. The clerk will report the amendment.
Amendment to the amendment in the nature of a substitute to H.R. 2646 offered by Mr. Green.
Without objection, the reading of the amendment is dispensed with, and the gentleman, Mr. Green, is recognized 5 minutes in support of his amendment.
Thank you, Mr. Chairman. This is a follow-up on our ranking member's amendment regarding the PME program. We use acronyms so often in D.C. that some of us get confused about what it is. That actually stands for Protection and Advocacy for Independent Mental Health Individuals with mental health issues. It's late in the evening. The PME program was created in 1986 to address pervasive abuse, neglect, and exploitation of the mentally ill. The program has maintained nearly 3 decades of success in serving its clients by resolving complaints, issuing issues surrounding allegations of maltreatment. The program advocates for some of our most vulnerable patients when no one else will. Sadly, this bill seems to attack the invaluable patient asset and purports the misguided idea that competent individuals recovering from mental illness cannot meaningfully participate in their own health care. I find this an attack on the First Amendment unconscionable. To be blunt, no American should lose their constitutional rights as a result of a diagnosed medical condition. Additionally, if a counselor takes a job working for a PME program, they should not lose their constitutional right to the First Amendment solely because of their profession. It's unprecedented to say that a lawyer cannot tell their client their rights. Health care works best when there are open and honest communications between patients, doctors, family members, and other individuals a patient wishes to consult with, including PME counselors. Any effort to restrict these conversations would only serve to harm the therapeutic relationship. Because of these reasons, I'm putting forth this amendment to strike the provision in the substitute amendment which restricts legal advocates from telling their individual of their rights under the law. Mr. Chairman, we were able to find, those of us who are at our age may remember Paul Harvey on the rest of the story. I want to give our response to Congressman Murphy's does not demonstrate the need for wholesale changes in the program. Rather, it shows the need for better community mental health services. First, the facts of the case do not show that the Protection and Advocacy Agency was the entity that William Bruce released, but they do show that the failure of psychiatrists to file the necessary paperwork to continue his involuntary commitment is the ultimate reason for his release. While one of Mr. Bruce's psychiatrists was concerned with his dangerousness, he never chose to file the paperwork necessary to continue his commitment. The other doctor, according to psychiatric notes, stated Mr. B appeared very unlikely to meet criteria for reinitiation of emergency involuntary status at the end of his court commitment on 4/30. In addition, Dr. X discussed discharging William on 4/24, but this did not work for ICMX, who requested a release on 4/20, which Dr. X agreed to. The doctor's decision came with full access to William's psychiatric progress notes as well as input from the staff and daily contact with William. Dr. X's first meeting with William, he reviewed record, discussed case with multiple colleagues. Ultimately, it was a failure of the psychiatrist to file the paperwork that led to Mr. Bruce's release. The P&A agency did not have the power to release Mr. Bruce. That was a decision made by psychiatrists. Following his release, Mr. Bruce was receiving intensive case management services for another 2 months in the community before the tragic killing of his mother. So we believe that the facts of the case are different than what the proponents say that's gutting this program at state. However, even if this story is how they tell it, this is one case out of more than 350 individual cases that PME program has dealt with since the enactment of 1986. While very tragic and avoidable if the psychiatrists had filed the paperwork they were supposed to fundamentally gut a program based on one example makes no sense. Show me the federal program that has a better track record than the PME program with one failure in 350,000 cases. Mr. Chairman, I yield back my time and and urge adoption of the amendment.
Chair thanks the gentleman. Is there further discussion on the Green Amendment? Dr. Murphy, recognized 5 minutes for your response.
All right, now we're getting into the core of the problem with schizophrenia and bipolar. This is extremely important. A person with schizophrenia, part of the characteristics that they have of symptoms is cognitive impairment with a neurological basis to that. Every time they have a breakdown, there is further neurological impairment. Multiple studies have shown on PET scans and MRIs, you can see differences in the brain imaging in the functions of a person with schizophrenia or bipolar versus a normal brain. You can see it deteriorate over time in terms of function and volume of the brain. Impairs on several levels. Initial perception, what we choose to look at, is based upon our experiences and our sense of what's going on. How we take that information in, the quality of our senses to take that information in, how we encode that information to our brain, how we decode that information to process it, our short-term memory as we're processing it, our long-term memory to pull things in, all of those are impaired in the brain of a person with schizophrenia, whether they are in the midst of an acute psychotic crisis or other things as well. When a person is talking to schizophrenia, even when one is stable, one who's trained and aware of this can pick up on some of those impairments. That being the case, an additional layer of this is oftentimes they have difficulty distinguishing reality from their perceptions. So when they're in the midst of their hallucinations and delusions, one of the reasons that it is difficult for them to function in the world, and we have heard this in some of our panels, witnesses have said, a woman who talked about being in a grocery store. She thought she heard voices over the loudspeaker in the store telling her that all the food was poison. Next thing you know, she hears a voice saying, clean up on aisle 5, and it turns out she was there, and she had removed every box of cereal from the shelves and was standing amidst them and trying to get a sense, how did this happen? These stories continue on, and our point is, when you're dealing with a person who lacks insight, one has to be extremely careful about that, particularly if one is not trained to know what they're doing. So while there are those out there, and I've said before, we have put things into this bill back in because I believe many things that the PAMI folks do is valuable. Supportive education, supportive housing, supportive employment, making sure they're not abused and neglected. I love them. Those are great, and we're supportive of those. But I'm also very concerned that when counseling an individual with serious mental illness who lacks insight into their condition and refusing medical treatment and providing them information without the knowledge, and many of these people, nearly all of them, are not psychiatrists, psychologists, are not trained, this troubles me. It should trouble all of us. Imagine if this was your child, your brother, your sister, your spouse. In the case of William Bruce, the parents were calling frantically. They didn't know where their son was. It wasn't until months later they found out. But this does happen in many cases when dealing with people with schizophrenia. This is the core thing about a brain illness. This is why we are here. This is why the states and federal government ought to be spending more and working on this. And so my concern here, and the reason I want to keep this in, is that people with a serious mental illness should not be counseled by someone who is not part of their care to make decisions on whether or not they should have that care. Because in such cases, they are fundamentally ignoring the very reason we're talking about this. When you look at the cases where tragedy has occurred around this country, and the pundits on the news say this all the time, why was this person discharged? Why wasn't he cared for? Why didn't something happen? This is really important, Mr. Pallone. I hope you can listen to me. In these cases where someone doesn't have this information, and people say, why was this person released? It is because in many cases you have people who do not understand the mind of the person who is seriously mentally ill. It is a brain disease. They may be carrying on a conversation with you. And I have had such conversations with hundreds and hundreds of people with serious mental illness, and you think you're having a conversation. Seconds later, they may tell you, we never talked about that. This is very, very important. We need to be sensitive to this. It is not the same as someone else. And this is why I'm very concerned that people without the training, without the professional responsibility, without the license to practice, are advising someone what to do with their medical treatment. And I hope we can keep this in the bill, and I hope people vote against the amendment. Thank you.
Chair, thanks.
Mr. Chairman.
Chair, thanks, gentlemen. Now recognize the ranking member. 5 minutes.
I won't take up a lot of time, but I want to assure Mr. Murphy I was listening to what he had to say, and I don't agree with you. Look, I understand you come here and you're a psychiatrist or psychologist. I'm sorry, which is it, psychiatrist?
Psychologist.
Psychologist. But, you know, you're not always right. And the bottom line is that these people there's no reason why you should restrict their legal representation and have this lawyer, or whoever it is, tell them their rights. Now, you know, you may think that in a given case that they're not cognizant or they're incompetent. Well, then go to court and have them declared incompetent. But if they're competent, and they have been declared incompetent, then they have the right to have someone tell them, you know, what their options are. And I understand that, you know, psychology is a field. I'm not an expert on it. But I am very concerned that, you know, somehow you're saying that because of the expertise that you have as a psychologist, these rights should be restricted. And I don't agree with that. I'm sorry. I don't. We're not always right. Just because someone's a psychologist or a psychiatrist doesn't mean that they're always right. And I think you stressed, and I agree with you, that every one of these cases is unique. Everyone is individualized. Well, then, if that's true, and I think it is, based on what you said and common sense, then there's no reason why every case shouldn't be looked at differently. Let them know what their rights are. If you think they're so incompetent that they don't understand, then they should be declared incompetent. But if they have not been, I see absolutely no reason why they shouldn't be able to be informed about what their options are, and not always say that the psychologist has it right. I'm sorry. That's my view. I listened very carefully to what you had to say. I yield back, Mr. Chairman, or I'll yield to Mr. Green.
You yield to whom?
Mr. Green wanted the time, or Mr. GK? Who wants it? Mr. Green?
Yeah, I appreciate our ranking member for yielding to me. And Congressman Murphy's story was very good, but didn't answer the question. In this case, the psychiatrist did not file the paperwork. That wasn't because of a volunteer helping. And I don't know if we have 350,000 cases we could go through, but you have to do your job if you're going to do that, to take somebody's rights away. And I could tell, and of course I was trying to make sure he got the least restrictive, but he got treatment. And I questioned him to ask him if I was going to make he was a Christian, because as a Christian we feel like we can be one with the Lord. I led off by asking if do you go to church? And the judge stood up and said, I think Green, I think your client needs to have a break, get water. And he took him out, and the bailiff took him out, and he said, Green, I can't believe you asked Jesus if he goes to church. That's the kind of hearings that you have, and you have to take them seriously because these people are ill, but they still have their rights just because they're ill, whether it be a volunteer or whether it be their legal counsel. And again, that's what we're talking about here. We're not talking about a story. We're talking about real help for folks to recognize whatever their rights are, and that they can be part of their cure if they want to. Because again, you don't get anything unless you get buy-in from those folks to say that they want this treatment. And I want to thank my colleague for yielding to me.
Butterfield, if he wants the time, or he wants his own time.
No, I was trying to claim time to yield to Mr. Green. I don't desire time. Thank you.
Give me a minute and I may think of something else.
Gentleman yields back. The chair recognizes Dr. Bouchon. 5 minutes for striking last words.
Yeah, Mr. Chairman, I think, you know, fundamentally that, again, we're having a discussion about this amendment, and I think what Chairman Murphy has been talking about is one of the biggest problems we have, I think, in our country is just the fundamental lack of understanding that mental illness is really a physical disease. There's changes in the brain, but that in many circumstances, people fundamentally just don't have a sense of reality. And I think it's very common for people that haven't taken care of these people to feel that you can talk them out of it or you can reason with these individuals. But unfortunately, the reality is you can, and it takes trained individuals to sometimes pick up on that. I wasn't a psychologist or a psychiatrist, but even as a medical professional, I had rather than myself. So I think it's very important that that we don't lose sight, versus basically a right to allow people to continue to be sick. And I yield back. Thank you.
Chair, thanks the gentleman. Now recognize the gentleman from Massachusetts. Strike the last words.
Mr. Chairman, move to strike the last word. I won't take the full time, Mr. Chairman. I appreciate my colleagues' comments from Indiana, and I'm not a doctor, and I certainly am not going to. Your experience in this and qualifications are obviously well above mine in looking at the medical diagnosis. I will say I was a prosecutor, and a number of the cases that I did prosecute, I don't have the firm numbers, but I will tell you anecdotally, an awful lot of folks were there because they were either suffering from substance abuse, mental illness, or drug abuse. And I think what you're hearing now in the course of this discussion ends up getting into the heart of perhaps how both sides are looking at the mental health system. I give Mr. Murphy a lot of credit for the diligence that he's put into this bill and the thoughtfulness. The effort at the moment around, from what I understand, where most of the focus of this bill is based around that critical care, at that step before people would be in my courtroom, to try to empower families, to try to share that information, to make sure that people don't end up going to jail or having some catastrophic accident. I think the pushback you're hearing from our side is to say, there's an awful lot that we can do much further upstream to ensure that people actually don't even get that far. And that when we do get that far, you are then necessarily talking about potentially compromising people's rights, particularly rights to privacy and other civil rights, that we just shouldn't put a price tag on in this country because we've decided that we won't. And if we have the ability to actually fully fund the system or more fully fund the system through Medicaid expansion, through increasing our reimbursement rates, through investments in primary care and other initiatives to ensure that everybody actually does have access to mental health care, then we can make sure that we can do a much better job of ensuring that the stories that you all have told so eloquently tonight actually don't happen, because they would never be in my courtroom to begin with. And that is the debate that you're hearing, which is not so much a disagreement as to what needs to be done, just where should we be doing it and how much emphasis and what are we willing to invest to ensure that we don't have the stories like the advocates are talking about here, and that many of my colleagues on the other side of the aisle have told me about they've seen in their emergency rooms and courtrooms. But we can actually do that, and it might be more expensive, but one, it's the right thing to do, and two, it will save us money, I'm convinced, at least most of it, in the long run, and three, it's part of the fundamental promise we make our people when you talk about civil rights. With that, I yield back.
Chair, thanks, gentlemen. Is further discussion on the Green Amendment? If not, the vote occurs on the amendment. Roll call. Yes. The clerk will call the roll.
Mr. Guthrie? No. Mr. Guthrie votes no. Mr. Barton? No. Mr. Barton votes no. Mr. Whitfield? Mr. Shimkus? No. Mr. Shimkus votes no. Mr. Murphy? No. Mr. Murphy votes no. Mr. Burgess? Mr. Burgess votes no. Mrs. Blackburn? Mrs. McMorris-Rogers? Mrs. McMorris-Rogers votes no. Mr. Lance? Mr. Lance votes no. Mr. Griffith? Mr. Bilrakis? No. Mr. Bilrakis votes no. Mr. Long? Mr. Long votes no. Mrs. Elmers? Mr. Bouchon? No. Mr. Bouchon votes no. Mrs. Brooks? Mrs. Brooks votes no. Mr. Collins? No. Mr. Collins votes no. Mr. Upton? No. Mr. Upton votes no. Mr. Green?
Aye.
Mr. Green votes aye. Mr. Engel? Aye. Mr. Engel votes aye. Ms. Cass? Mr. Butterfield votes aye. Ms. Castor? Ms. Castor votes aye. Mr. Sarbanes? Mr. Sarbanes votes aye. Ms. Matsui? Ms. Matsui votes aye. Mr. Lujan? Mr. Lujan votes aye. Mr. Schrader? Mr. Schrader votes aye. Mr. Kennedy? Mr. Kennedy votes aye. Mr. Cardenas? Mr. Cardenas votes aye. Mr. Pallone? Mr. Pallone votes aye. Chairman Pitts.
No.
Chairman Pitts votes no. Mrs. Blackburn? Mrs. Blackburn votes no.
Any other members seeking a recorded vote? If not, the clerk will report the vote.
Mr. Chair.
Have it. The amendment is not agreed to. Are there further amendments to the amendment in the nature of the substitute? Mr. Cardenas, recognized to offer an amendment. What's the number?
Number 43.
The amendment in the nature of a substitute to H.R. 2646 offered by Mr. Cardenas of California.
Without objection, the reading of the amendment is dispensed with. The gentleman, Mr. Cardenas, is recognized 5 minutes in support of his amendment.
Thank you, Mr. Chairman. I'll make my comments as brief as possible in the interest of time. We've been discussing the consequences of not properly investing in mental health care, and this shows up in our nation's jails more than anywhere else, particularly the jails where kids are put in. Federal law does not allow these kids have to be kicked off of Medicaid completely. And yet that is exactly what many states do, often because that is just how their system happens to be set up. For them, terminating Medicaid coverage is easier than suspending it temporarily. When kids who already were on Medicaid are allowed to resume their needed access to mental health care, once they're released, less crimes are committed, and government saves dollars to the tunes of millions and millions of dollars a year when crime goes down, because these children have access to the care that they deserve and are allowed to have and they need. This amendment, once again, does not expand Medicaid. It allows states to suspend instead of terminating kids who are already in the program. I yield back.
Chair, thanks you, gentlemen. Is there further discussion on the Cardenas amendment?
Mr. Chairman.
All right.
I'd like to, if I could strike the last word.
Chair recognizes Mr. Green. Strike last word.
Mr. Cardenas, the bill allows suspension. So what you're saying is they just suspend the Medicaid benefits. Does the county or the state then is qualified to receive Medicaid benefits for the services of that child while they're in juvenile justice centers?
Not while they're incarcerated, and my amendment doesn't affect that. Okay. Only, but to answer your question, what my amendment does, the custom and practice of many states is that when the person is incarcerated, they seem to find it simpler just to cancel their coverage. So when they get out, what happens is they go too far, too long without coverage. And in this case, when it comes to mental health, as what Congressman Murphy mentioned earlier, someone with a mental health condition is 15 times more likely to commit some kind of crime or hurt somebody. So this will allow the states to be reminded that they do not have to terminate. They can go ahead and suspend. So that way, when the person is released, then they can go ahead and resume their coverage.
Resume their coverage, I think is a good.
Thank you.
Chair, thanks to the gentleman. If there's no further discussion, the vote occurs on the amendment. All those, do you want a roll call? The clerk will call a roll.
Mr. Guthrie? No. Mr. Guthrie votes no. Mr. Barton? Mr. Barton votes no. Mr. Whitfield? Mr. Shimkus? Mr. Shimkus votes no. Mr. Murphy? No. Mr. Murphy votes no. Mr. Burgess? Mrs. Blackburn? Mrs. McMorris-Rogers? Mrs. McMorris-Rogers votes no. Mr. Lance? Mr. Lance votes no. Mr. Griffith? Mr. Bilirakis? Mr. Bilirakis votes no. Mr. Long? Mr. Long votes no. Mrs. Elmers? Mr. Bouchon? Mr. Bouchon votes no. Mrs. Brooks? Mrs. Brooks votes aye. Mr. Collins? Mr. Collins votes no. Mr. Upton? Mr. Upton votes no. Mr. Green? Mr. Green?
Aye.
Mr. Green votes aye. Mr. Engel? Aye. Mr. Engel votes aye. Ms. Capps? Ms. Capps votes aye. Ms. Schakowsky? Ms. Schakowsky votes aye. Mr. Butterfield? Aye. Mr. Butterfield votes aye. Ms. Castor? Ms. Castor votes aye. Mr. Sarbanes? Mr. Sarbanes votes aye. Ms. Matsui? Ms. Matsui votes aye. Mr. Lujan? Aye. Mr. Lujan votes aye. Mr. Schrader? Aye. Mr. Schrader votes aye. Mr. Kennedy? Mr. Kennedy votes aye. Mr. Cardenas? Aye. Mr. Cardenas votes aye. Mr. Pallone? Aye. Mr. Pallone votes aye. Chairman Pitts.
No.
Chairman Pitts votes no.
Are
Mrs.
there
Blackburn.
other recorded, Mr.
Mrs. Blackburn votes no.
Other recorded votes? We lost that vote. He said, wait a minute. The clerk will report the vote.
Mr. Chairman, on that vote, there are 14 ayes and 13 nays.
The ayes have it. The amendment is agreed to. Are there any other recorded or any other amendments to the amendment in nature of a substitute?
Mr. Chairman, I have an amendment number 33.
Mr. Pallone offers amendment number 33. The clerk will report the amendment.
Amendment to the amendment in the nature of a substitute to H.R. 2646 offered by Mr. Pallone.
Without objection, the reading of the amendment is dispensed with. The gentleman, Mr. Pallone, is recognized for 5 minutes in support of the amendment.
Mr. Chairman, this amendment would comprehensively attempt to address our nation's serious, intractable opioid crisis. We're in the middle of an unprecedented opioid and heroin crisis. In 2013, prescription opioids were involved in 16,235 overdose deaths. Additionally, there were a total of 8,000 overdose deaths connected to heroin. I know each and every single member on this dais knows that this crisis is hitting home, and it's hitting hard. What is most tragic about the situation is that we have known tools and established evidence-based interventions to prevent overdose and treat addiction. Treatment gaps continue to limit our ability to address the burgeoning crisis. Screening and early intervention are rare, and only 1 in 10 people struggling with addiction receive any form of treatment. What is most tragic about the situation is that we have known tools and established evidence-based interventions to prevent overdose and treat addiction, such as naloxone and medication-assisted treatment. But patients across the country still face significant barriers to access. Additionally, we must address the problem of overprescribing. Last year, generic Vicodin was the most commonly prescribed drug in the Medicare Part D program. According to NIDA, the number of prescriptions for opioids in the U.S. escalated from 76 million in 1991 to about 207 million in 2013. My amendment would address both the upstream and downstream effects of the opioid crisis. It would address overprescribing of opioids by mandating that prescribers take 12 hours of mandatory continuing medical education every 3 years on safe opioid prescribing and identifying the signs of addiction. It would expand the number of patients that providers can treat in an office space for opioid addiction, which is currently limited by a set of arbitrary patient caps. It establishes a demonstration setting with buprenorphine for opioid addiction, which is currently limited by a set of arbitrary patient caps. It establishes a demonstration program to encourage prescribing of naloxone and increases funding for a program to treat pregnant and postpartum women for substance use disorders. It provides new resources to expand access to medication-assisted treatment. The administration has taken a number of critically important steps recently to address this crisis, to expand access to medication-assisted treatment, and to address overprescribing. But Congress must also lead on this issue. Our constituents expect it, and they depend on us. I hope we can begin this process today by considering my amendment and others to address the opioid crisis. I know that members on both sides of the aisle do want action and want to get something tangible accomplished. So let's get something over the finish line, and let's do it soon. I yield back my time, and I yield to Mr. Sarbanes.
I thank the gentleman for yielding, and I certainly support his amendment. I'd note that one of the items he mentioned that would be addressed by the amendment is a demonstration project to examine the benefits of co-prescribing naloxone at the time that opioids are prescribed to certain patients that meet certain criteria. And I do want to note that Representative Bouchon is supportive of this approach as well. We've co-sponsored bipartisan legislation that would support this kind of a demonstration project for naloxone. Naloxone is a drug that very safely and effectively reverses both opioid and heroin-induced overdoses if administered in time. It's been used by non-medical personnel with only minimal training for over 15 years, and more people need access to this life-saving medication. So creating a demonstration project that would include federally qualified health centers, opioid treatment centers, and other providers to encourage co-prescribing naloxone makes a lot of sense. The opioid overdose epidemic is exactly that. It's a public health epidemic, and if we can increase access to naloxone, particularly through this co-prescribing opportunity, it can make a big difference. Colleagues to support it as well, and I yield back.
Chair, thanks, gentlemen. Is there further discussion on the Pallone amendment?
Mr. Chairman,
Who seeks recognition?
move to strike the last word.
Go ahead.
Mr. Lujan's recognized. 5 minutes, strike the last words.
Mr. Chairman, one of the pieces included in this en bloc amendment is a piece of legislation. It's an amendment that would reauthorize the importance and bringing recognition to treatment for pregnant and postpartum women. Our communities are hurting, and illicit drugs like heroin and prescription drug abuse have led to an epidemic of drug overdose plaguing New Mexico and our nation. The most recent data from New Mexico's health department puts the accidental drug overdose rate at 24.3 per 100,000. That is more than double the national average. In 2 counties in my district, the overdose rate is more than 5 times the national average. People need access to mental health providers and doctors. Our citizens need access to medicine and care because this crisis touches everyone, and my communities in New Mexico know too well that accessing resources and services can often be an impossible challenge. That's why I'm offering the text of my bill, the Improving Treatment for Pregnant and Postpartum Women Act, as an amendment today. This bill will strengthen an existing program to ensure that some of our most vulnerable get the care that they need. You cannot separate substance abuse from mental health. My amendment will help ensure that people get the care they need back home in New Mexico and throughout the nation. I thank Ranking Member Green and Representative Pallone for including my bill in the Democratic substitute and this important issue. There were several bills that were included in that hearing, and I didn't hear any of our colleagues speak. It was a very important hearing for me and in my district as we talk about this issue all across America, but for some reason they weren't included in this package. And so when we're reaching out to people all across America, but especially to people in New Mexico, and it appears that pieces of legislation that are bipartisan will be included but are not included, it concerns me. And so I'm very hopeful, Mr. Chairman, that pieces of legislation like this that are so important to providing support for addiction, for support for treatment, for prevention, that these somehow find a way to make it in before we go to full committee markup. It was an extraordinary hearing. I was proud to be a part of it. The pieces of legislation were very thoughtful. They were bipartisan. They deserve to be in a final package. And so with that, Mr. Chairman, if any of my colleagues would like any time, if not, I'd yield back.
Chair, thanks, gentlemen. The chair recognizes Mr. Upton.
Thank you. We appreciate the amendment on this side. It's, as you all know, we've had a number of hearings on it. It's a very complex issue. Frankly, we haven't had much time to study this. I've talked to both Dr. Bashan and Ms. Brooks, who have been very, they've worked very hard on this idea as well. I'd like to think that at the end of the process, in fact, this could be part of the bill, but I'm not sure that we've had the time, the right amount of time to study it. And I don't know if the gentleman would be prepared to withdraw it, and we'll further study it between now and when we get up to full markup, but appreciate if he might be able to do so, knowing that, in fact, we intend to work very closely with him. Just not having the opportunity to really study it in the last couple hours since it was introduced.
Would the gentleman yield?
Be glad to.
Look, I said before, and I'm going to say again, we started out, I don't know, 12 hours ago, whenever it was, and, you know, statements were being made by the GOP that they did not have, you know, they didn't know what we wanted. They didn't know what we were presenting, that we didn't have anything to present. So, I mean, that's not true. and maybe I'm mischaracterizing what you said, but that was what I heard. And so, you know, we're putting these amendments out. We want to vote on them. Hopefully between now and the full committee, there will be an effort to incorporate our concerns. And I think that the chairman has made it quite clear that he wants to know, Mr. Murphy wants to know everything that we would like to see in this bill. So this is one of those items that's very important, and I would like to proceed with the roll call.
Is there further discussion on the Pallone amendment? The gentlelady, Ms. Capps, recognized. Strike last words.
Thank you, Mr. Chairman. I wish to strike the last word and speak in favor of this amendment offered by Mr. Pallone. When we look at the behavioral health field, so often people get frustrated. These issues are complex, and there's no clear pathway for treatment. And while that may be true for many ailments, our nation, some with opioid addiction, access to the most appropriate form of medication-assisted treatment is a lifeline out of addiction. But both research and anecdotal evidence have pointed to the fact that access to this care is often difficult. A recent study published in the American Journal of Public Health showed that access to buprenorphine or methadone treatment is less than half of what the need is. Currently, physicians can apply to prescribe buprenorphine as part of the range of healthcare services offered in their practices. But unlike a physician's ability to prescribe pain medication as they see fit, prescribing which has contributed to the epidemic, prescribers of buprenorphine are limited in the number of patients that can be treated with this medication with a cap of 30 patients. It is the only instance of a numerical cap being applied to the number of patients a provider can prescribe an FDA-approved drug. So what we have here is the potential problem caused by prescription pain medication that is uncapped, but a potential solution is severely limited. This makes no sense. This amendment includes language from the TREAT Act, a bipartisan bill which would gradually lift the arbitrary cap of 30 patients that can be treated per providers. It also clarifies that all qualified providers can participate in prescribing this important treatment per state licensure. This includes qualified physicians, nurse practitioners, and physician's assistants. This is a common sense effort to help make treatments available to those who need them, and it is an effort with bipartisan support. It's an important step to help those affected by opioid addiction. I urge my colleagues to support this amendment. And I'm prepared to yield to another colleague and to my colleague from Illinois, Ms. Schakowsky.
Thank you. Mr. Chairman, I would like unanimous consent to put into the record a letter from the Illinois Alcoholism and Drug Dependence Association.
Without objection.
And
so
let me
ordered.
read one, thank you. And let me read one paragraph. As you know, this letter says, the nation is in the midst of an opioid crisis. Heroin use has more than doubled among young adults ages 18 to 25 over the past 10 years, while the number of Americans aged 12 or older using opioids non-medically has reached approximately 4.5 million. This trend has led to tragic results for far too many Americans. 17,000 lost their lives to an opioid pain reliever overdose and more than 8,000 to a heroin overdose. We believe it's time to invest more in programs that help the millions of Americans with the primary disease of addiction, and to maintain programs that have a unique focus on the challenges associated with alcohol and other drugs. This is what the Pallone Amendment addresses. I support that, and I am thankful that this will be put now on the record. And I yield back to the lady.
Gentleman, go back.
I'll yield back.
Gentlelady yields back. Is there further discussion on the amendment? Dr. Murphy, recognized for 5 minutes.
Just briefly on this. This is an area that we have been holding hearings both in Health Subcommittee in the past and oversight and investigation. A very complex issue. And I know that Dr. Bouchon, I know that Ms. Brooks, I know that Mr. Tonko and some others have been working on this thing. This is an issue that has to be done right, and it's the work of this committee that's working on that. One of the points in this, too, that when we had Dr. Richard Frank, the Assistant Secretary for Planning and Evaluation under HHS here, one of the questions he was asked when dealing with this issue, moving from 30 to 100, people to write prescriptions of. He was asked, how much time does someone spend with patients? They said they don't know. They have to study that. Because buprenorphine is the third most diverted drug. That is, when people get it, they don't take it, they sell it, and they go out and get heroin. And that people who have an addiction problem, 90% of them are not in an evidence-based program. So we are all in agreement that this has got to be dealt with. But what I'd say is, you got people on this committee who are working on this on both sides of the aisle. I don't think we should jump ahead of them, because they're doing some serious work on this. I would like that bipartisan subgroup to continue to work on this, and the health of the subcommittee to continue to work on this. We have to get this thing right, and I think some of the things in here right now would undermine that work of those groups trying to do that. And so I would urge, at this point, if it can't be withdrawn, then to vote no on this so we can continue work in the committee. Thank you.
Is there further discussion on the Pallone amendment? If there's no further discussion, the vote occurs on the amendment. All those in favor, call the roll.
Mr. Guthrie. Mr. Guthrie votes no. Mr. Barton. Mr. Barton votes no. Mr. Whitfield. Mr. Shimkus. Mr. Shimkus votes no. Mr. Murphy. Mr. Murphy votes no. Mr. Burgess. Mrs. Blackburn. Mrs. McMorris Rogers. Mrs. McMorris Rogers. Mrs. McMorris Rogers votes no. Mr. Lance. Mr. Lance votes no. Mr. Griffith. Mr. Griffith votes no. Mr. Bilrakis. Mr. Bilrakis votes no. Mr. Long.
No.
Mr. Long votes no. Mrs. Elmers. Mr. Bouchon. Mr. Bouchon votes no. Mrs. Brooks. Mrs. Brooks votes no. Mr. Collins. Mr. Collins votes no. Mr. Upton. Mr. Upton votes no. Mr. Green. Mr. Green votes aye. Mr. Engel. Mr. Engel votes aye. Ms. Capps. Ms. Capps votes aye. Ms. Schakowsky. Ms. Schakowsky votes aye. Mr. Butterfield. Mr. Butterfield votes aye. Ms. Castor. Ms. Castor votes aye. Mr. Sarbanes. Mr. Sarbanes votes aye. Ms. Matsui. Ms. Matsui votes aye. Mr. Lujan. Mr. Lujan. Mr. Cardenas votes aye. Mr. Pallone. Mr. Pallone votes aye. Chairman Pitts. Chairman Pitts votes no. Mrs. Blackburn. Mrs. Blackburn votes no. Dr. Burgess votes no.
If not, the clerk will report the vote.
Mr. Chairman, on that vote, there were 13 ayes and 16 nays.
The nays have it. The amendment is not agreed to. Are there any other amendments to the amendment in nature of a substitute?
Mr. Chairman, I have an amendment at the desk.
Butterfield's recognized. What's the number?
Butterfield 1.
1. The clerk will report the amendment.
Yes.
Amendment to the amendment in the nature of a substitute to H.R. 2646 offered by Mr. Butterfield of North Carolina.
Without objection, the reading of the amendment is dispensed with. The gentleman, Mr. Butterfield, is recognized 5 minutes in support of his amendment.
Thank you, Mr. Chairman. Mr. Chairman, my amendment seeks to reduce an important health disparity that our nation is facing. That disparity is in the health care workforce. According to SAMHSA, less than 20% of America's behavioral health workforce is comprised of racial minorities. That is not representative of the diversity in our nation, and we can do better. My amendment simply makes an investment in the minority.
If the gentleman will
program.
yield,
I will yield.
be glad to accept the amendment on a voice vote.
You're very kind, Mr. Chairman. Thank you. I yield back.
All those in favor
Aye.
shall signify by saying aye. All those opposed, no.
Yeah.
The ayes have it.
Tony?
The amendment's agreed to.
Tony?
Mr. Chairman, I have an amendment at the desk. Amendment 2. Number 2.
Amendment to the amendment in the nature of a substitute to H.R. 2646.
Oh, I apologize, Mr. Chairman. This is 49. I apologize. 49.
Amendment to the amendment in the nature of a substitute to H.R. 2646 offered by Mr. Ben Ray Lujan of New Mexico.
Without objection, the reading of the amendment is dispensed with. Gentleman, Mr. Lujan, is recognized 5 minutes in support of his amendment.
Thank you, Mr. Chairman. This amendment to H.R. 2646 includes 2 provisions that would strengthen state behavioral health systems and help patients and families. The first provision would provide an enhanced federal medical assistance percentage, FMAP, of 90% to states that prioritize behavioral health infrastructure, data, and access. If we want states to build and maintain strong behavioral health systems, then we must provide states with the necessary support. An enhanced FMAP would encourage states to prioritize investments in behavioral health. The United States has never supported mental health in this way, and with the expansion of Medicaid across the country, we must ensure that states continue to improve their capacity to provide mental health services. In my home state of New Mexico, our behavioral health system is in a crisis after the state of New Mexico froze payments to 15 New Mexico behavioral health providers, resulting in the eventual closure of some and replacement by 5 Arizona providers. Since this transition, 2 of those 5 Arizona providers have left New Mexico. This transition and turmoil caused many New Mexicans to fall through the cracks. As a result, too many families are hurting, too many people are suffering, and too many New Mexicans were unable to access the care they need. This amendment would encourage my home state to make the necessary investments to rebuild this damaged system. It would also encourage my home state to strengthen its data collection efforts. During the New Mexico delegation's many conversations with CMS on this crisis and its impact on New Mexicans, the New Mexico delegation asked CMS to provide us with data it was collecting from New Mexico. We hope this data could better provide us with a better understanding of what was happening. CMS went on to say that this left them, CMS, largely unable to determine, and I quote, areas and populations may be experiencing decreases in utilization, close quote. A report from the New Mexico legislature, the Finance Committee, identified similar concerns. The report stated that the amount and quality of utilization data collected by the state had, and I quote, deteriorated, leaving the question of whether enrollees are receiving more or less care. Mr. Chairman, this is simply unacceptable. Without access to meaningful data, it is impossible for the people of New Mexico to hold policymakers and administrators of programs accountable. Without access to meaningful data, how can anyone know if enough is being done to ensure that the most vulnerable are being protected? Without access to meaningful data, how can anyone determine how best to invest to strengthen our behavioral health system? Finally, my amendment encourages states to create a behavioral health ombudsman to collect, track, and quantify programs and problems and inquiries encountered by individuals with respect to access, educate individuals on their rights and responsibilities, and assist individuals in accessing behavioral health services by providing information, referral, and assistance. This would provide individuals suffering from mental health issues with a powerful advocate. I know that every member of this committee wants to make things better, and I know that each of us wants to fix our broken mental health system. But to do this, we must work together to have the necessary investments to support people and families in need. I believe that this amendment does that, and I encourage my colleagues to support it. Thank you, Mr. Chairman. I yield back.
Chair, thanks, gentlemen. Is there further discussion on the Lujan amendment? Seeing none, clerk will call the roll.
Mr. Guthrie? No. Mr. Guthrie votes no. Mr. Barton? Mr. Whitfield? Mr. Shimkus? No. Mr. Shimkus votes no. Mr. Murphy? No. Mr. Murphy votes no. Mr. Burgess? Mrs. Blackburn? Mrs. McMorris-Rogers? Mrs. McMorris-Rogers votes no. Mr. Lance? Mr. Lance votes no. Mr. Griffith? Mr. Griffith votes no. Mr. Bilirakis? Mr. Bilirakis votes no. Mr. Long? Mrs. Elmers? Mr. Bouchon? No. Mr. Bouchon votes no. Mrs. Brooks? Mrs. Brooks votes no. Mr. Collins? No. Mr. Collins votes no. Mr. Upton? No. Mr. Upton votes no. Mr. Green?
Aye.
Mr. Green votes aye. Mr. Engel? Aye. Mr. Engel votes aye. Ms. Capps? Aye. Ms. Capps votes aye. Ms. Schakowsky? Aye. Ms. Schakowsky votes aye. Mr. Butterfield? Aye. Mr. Butterfield votes aye. Ms. Castor? Aye. Ms. Castor votes aye. Mr. Sarbanes? Aye. Mr. Sarbanes votes aye. Ms. Matsui? Aye. Ms. Matsui votes aye. Mr. Lujan? Aye. Mr. Lujan votes aye. Mr. Schrader? Aye. Mr. Schrader votes aye. Mr. Kennedy? Aye. Mr. Kennedy votes aye. Mr. Cardenas? Aye. Mr. Cardenas votes aye. Mr. Pallone? Aye. Mr. Pallone votes aye. Chairman Pitts?
No.
Chairman Pitts votes no.
Are there others seeking recorded vote? Mr. Long?
Mr. Long votes no.
Ms. Blackburn?
Mrs. Blackburn votes no.
Mr. Barton?
Mr. Barton votes no.
Dr. Burgess?
Dr. Burgess votes no.
Are there others seeking recorded vote? The clerk will report the vote.
Mr. Chairman, on that vote, there were 13 ayes and 16 nays.
The nays have it. The amendment is not agreed to. Are there any other amendments to be offered to the amendment nature of substitute? Mr. Kennedy is recognized to offer an amendment. What's the number?
Thank you, Mr. Chairman. Number 27, please.
Number 27. The clerk will report the amendment.
Amendment to the amendment in the nature of a substitute to H.R. 2646 offered by Mr. Kennedy.
Without objection, the reading of the amendment is dispensed with. And the gentleman, Mr. Kennedy, is recognized 5 minutes in support of his amendment.
Thank you very much, Mr. Chairman. Mr. Chairman, this amendment would establish a new grant program to better integrate behavioral health care into primary care settings. It would authorize the Assistant Secretary for Mental Health and Substance Abuse Disorders to award grants to cooperative agreements to eligible entities to provide integrated services related to screening, diagnosis, and treatment for mental illness, substance use disorders, and co-occurring primary care conditions and chronic diseases. Further, it would require the Secretary to establish a program to provide training and technical assistance to eligible entities for the development and dissemination of evidence-based interventions and integrated care. In many ways, mental health care and treatment for substance abuse is siloed and separate from the rest of the healthcare system. Integrating these two systems improves efficiencies, saves money, and most importantly, is best for patients. According to a 2014 Kaiser Family Foundation report, individuals with serious mental illness die on average 25 years earlier than the general population. Disproportionately, these deaths are from preventable conditions like cardiovascular disease and obesity. By better integrating care, we can address this dangerous fragmentation. After all, for many patients, a trip to the doctor or for a sore throat or simple checkup can be a critical window of opportunity for doctors to screen for substance abuse or depression and to make referrals as appropriate. I ask my colleagues to join me in support of this amendment. I'll yield to any member on our side that wants to speak, and seeing none, I will yield back.
Chair, thanks, gentlemen. Is there further discussion on the Kennedy amendment? If there's no further discussion, the vote occurs on the amendment. Do you want to roll call? Clerk, call the roll.
Mr. Guthrie. No. Mr. Guthrie votes no. Mr. Barton. Mr. Whitfield. Mr. Shimkus. No. Mr. Shimkus votes no. Mr. Murphy. Mr. Murphy votes no. Mr. Burgess. Mr. Burgess votes no. Mrs. Blackburn.
No.
Mrs. Blackburn votes no. Mrs. McMorris Rogers. Mrs. McMorris Rogers votes no. Mr. Lance. Mr. Lance votes no. Mr. Griffith. Mr. Griffith votes no. Mr. Bilrakis. Mr. Bilrakis votes no. Mr. Long. Mr. Long votes no. Mrs. Elmers. Mr. Bouchon. Mr. Bouchon votes no. Mrs. Brooks. Mrs. Brooks votes no. Mr. Collins. Mr. Collins votes no. Mr. Upton. Mr. Upton votes no. Mr. Green.
Aye.
Mr. Green votes aye. Mr. Engel. Mr. Engel votes aye. Ms. Capps. Ms. Capps votes aye. Ms. Schakowsky. Ms. Schakowsky votes aye. Mr. Butterfield. Mr. Butterfield votes aye. Ms. Castor. Ms. Castor votes aye. Mr. Sarbanes. Mr. Sarbanes votes aye. Ms. Matsui. Ms. Matsui votes aye. Mr. Lujan. Mr. Lujan votes aye. Mr. Schrader. Mr. Schrader votes aye. Mr. Kennedy. Mr. Kennedy votes aye. Mr. Cardenas. Mr. Cardenas votes aye. Mr. Pallone. Mr. Pallone votes aye. Chairman Pitts.
No.
Chairman Pitts votes no.
Are there other members seeking? Mr. Barton?
Mr. Barton votes no.
The clerk will report the vote.
Mr. Chairman, on that vote, there were 13 ayes and 16 nays.
The nays have it. The amendment is not agreed to. Are there other amendments? To
Mr. Chairman, I have an amendment at the desk.
Mr. Lujan is recognized to offer amendment. What number?
Amendment number 1.
Number 1. The clerk will report the amendment.
Amendment to the amendment in the nature of a substitute to H.R. 2646 offered by Mr. Ben Ray
Without
Lujan of New
objection,
Mexico.
the reading of the amendment is dispensed with. The gentleman, Mr. Lujan, is recognized 5 minutes in support of this amendment.
Mr. Chairman, thank you so much. This amendment to H.R. 2646 expresses that it is the sense of Congress that the Secretary, in carrying out programs for Native American youth and suicide prevention programs for youth suicide intervention, shall prioritize programs and activities for those that are high risk or have disproportional...
Will the gentleman yield on that? This is a great amendment, and also because you have several members who represent Native Americans, like Mr. Schrader and other members, high priority. We recommend it be accepted by voice vote right away.
Mr. Chairman, if I may, just before we go to a voice vote, I failed to offer a few letters into and an article into the record. If I may ask unanimous consent to submit into the record a letter dated November 3rd to Chairman Upton and Ranking Member Pallone from several organizations that are concerned with an inclusion of a provision in the manager's amendment that would strike support for mental health and substance use disorder block grant funds. So we're concerned about some of the provisions. It was addressed by Ms. Brooks, but I think it's important to offer this into the record. And a letter written from the state of New Mexico in September 23rd, 2014, from Health and Human Services Department to Cindy Mann, the Director for Center for Medicaid and State Operations, and an article from the Albuquerque Journal dated Wednesday, September 24th, 2014, 12:02 a.m. Behavioral Health Service rolls up 30% of state.
Without objection, so ordered. The vote occurs on the amendment. All those in favor shall signify by saying aye. Aye. All those opposed, nay. The ayes have it. The amendment is agreed to. Are there any other amendments to the amendment nature of a substitute? Mr. Cardenas recognized to offer an amendment. What's the number?
Amendment number 32, Mr. Chairman.
Clerk will report the amendment.
Amendment to the amendment in the nature of a substitute offered by Mr. Cardenas.
Without objection, the reading of the amendments dispensed.
Advances and new technologies are providing Americans with longer, healthier lives than ever before. But for many minority populations, that promise of a longer life remains just that, a promise. They tend to live shorter lives than their counterparts. It is proven beyond any doubt that there are disparities in health between different racial, ethnic, sexual, and gender populations. Finding a way to make sure to get everyone the care that they need to create the outcomes we know are possible remains incredibly difficult. Health outcomes are often driven by the social conditions in which individuals live, learn, work, and play, and also the care that they have access to. That's not just true for physical health. Mental health diagnosis and treatment is already less effective across our society. Minority-based disparity only worsens that situation. My amendment establishes a new grant program that provides educational programs for health professionals to address behavioral health disparities among racial, ethnic, sexual, and gender minority groups. I yield back.
The gentleman, is there anyone seeking discussion on the Cardenas amendment? Seeing none, the vote occurs on the amendment. You want a roll call? Clerk will call the roll.
Mr. Guthrie. Mr. Guthrie votes no. Mr. Barton. Mr. Barton votes no. Mr. Whitfield. Mr. Shimkus. Mr. Shimkus votes no. Mr. Murphy. Mr. Murphy votes no. Mr. Burgess. Mr. Burgess votes no. Mrs. Blackburn. Mrs. McMorris Rogers. Mr. Lance. Mr. Lance votes no. Mr. Griffith. Mr. Griffith votes no. Mr. Bilrakis. Mr. Bilrakis votes no. Mr. Long. Mrs. Elmers. Mr. Bouchon. Mr. Bouchon votes no. Mrs. Brooks. Mrs. Brooks votes no. Mr. Collins. Mr. Collins votes no. Mr. Upton. Mr. Upton votes no. Mr. Green.
Aye.
Mr. Green votes aye. Mr. Engel. Mr. Engel. Mr. Castor votes aye. Mr. Sarbanes. Mr. Sarbanes votes aye. Ms. Matsui. Ms. Matsui votes aye. Mr. Lujan. Mr. Lujan votes aye. Mr. Schrader. Mr. Schrader votes aye. Mr. Kennedy. Mr. Kennedy votes aye. Mr. Cardenas.
Aye.
Mr. Cardenas votes aye. Mr. Pallone. Mr. Pallone votes aye. Chairman Pitts.
No.
Chairman Pitts votes no.
Are there members seeking a recorded vote? Mr. Long.
Mr. Long votes no.
Ms. Blackburn.
Ms. Blackburn votes no.
Ms. McMorris Rogers.
Mrs. McMorris Rogers votes no.
Anyone else seeking a recorded vote? Seeing none, the clerk report the vote.
Mr. Chairman, on that vote, there were 13 ayes and 16 nays.
The nays have it. The amendment is not agreed to. Are there any other amendments to the amendment nature of substitute? Mr. Butterfield. Recognize our amendment. What number?
Thank you, Mr. Chairman. I believe it's Butterfield 5.
5. Clerk report the amendment.
Amendment to the amendment in the nature of a substitute to H.R. 2646 offered by Mr. Butterfield of North Carolina.
Without objection, the reading of the amendments is dispensed with. The gentleman, Mr. Butterfield, is recognized 5 minutes in support of his amendment.
Thank you, Mr. Chairman. Mr. Chairman, my amendment would require a report addressing social determinants of health, Social determinants of health include many factors such as where people are born, where they grow up, where they live and work, and their age, as well as broader conditions of daily life. These factors, Mr. Chairman, are especially important in identifying health disparities which disproportionately impact African American and other Americans of color. Social determinants of health can be important variables in the mental health needs of certain populations, yet this bill does not appear to address social determinants of health. This amendment would change that by requiring that the new Assistant Secretary created by the bill to submit to Congress and make publicly available a report on activities across HHS focused on addressing social determinants of health, specifically relating to mental and behavioral health. In addition, this amendment would require the new Assistant Secretary to provide recommendations for policies to improve efforts to address social determinants in programs administered by HHS relating to mental and behavioral health. This is a common sense amendment, Mr. Chairman, and I would ask that my colleagues support it. I yield back.
Chair, thanks, gentlemen. Is there any other further discussion on the Butterfield amendment? Seeing none, the vote occurs on the amendment.
Voice vote. I may,
All those
I
in
may get
favor-
lucky tonight. Let's try a voice vote.
All those in favor shall signify by saying aye. Roll call.
Yes, I do want a roll call. Yes, I do.
Clerk will call a roll.
Yes.
Mr. Guthrie. Mr. Guthrie votes no. Mr. Barton. Mr. Barton votes no. Mr. Whitfield. Mr. Shimkus. Mr. Shimkus votes no. Mr. Murphy. Mr. Murphy votes no. Mr. Burgess. Mr. Burgess votes no. Mrs. Blackburn. Mrs. Blackburn votes no. Mrs. McMorris-Rogers. Mrs. McMorris-Rogers votes no. Mr. Lance. Mr. Lance votes no. Mr. Griffith. Mr. Griffith votes no. Mr. Bilrakis. Mr. Bilrakis votes no. Mr. Long. Mr. Long votes no. Mrs. Elmers. Mr. Bouchon. Mr. Bouchon votes no. Mrs. Brooks. Mrs. Brooks votes no. Mr. Collins. Mr. Collins votes no. Mr. Upton. Mr. Upton votes no. Mr. Green. Mr. Green votes aye. Mr. Engel. Mr. Engel votes aye. Ms. Capps. Ms. Capps votes aye. Ms. Schakowsky. Ms. Schakowsky votes aye. Mr. Butterfield. Mr. Butterfield votes aye. Ms. Castor. Ms. Castor votes aye. Mr. Sarbanes. Mr. Sarbanes votes aye. Ms. Matsui. Ms. Matsui votes aye. Mr. Lujan. Mr. Lujan votes aye. Mr. Schrader. Mr. Schrader votes aye. Mr. Kennedy. Mr. Kennedy votes aye. Mr. Cardenas. Mr. Cardenas votes aye. Mr. Pallone. Mr. Pallone votes aye. Chairman Pitts. Chairman Pitts votes no.
If
Mr. Chairman, on that vote, there were 13 ayes and 16 nays.
the nays have it, the amendment is not agreed to. Are there any other amendments to the amendment nature of substitute? Ms. Castor, recognized to offer an amendment. What's the number, please?
I'd like to ask unanimous consent to offer my two amendments in block, number 62 and number 63.
Number 62 and
63.
63. Clerk will report the amendments.
Amendment to the amendment in the nature of a substitute to H.R. 2646, offered by Ms. Castro of Florida. Amendment to the amendment in the nature of a substitute to H.R. 2646, offered by Ms. Castro of Florida.
Without objection, the reading of the amendments are dispensed with, and the gentlelady, Ms. Castor, is recognized 5 minutes in support of her amendment.
Thank you very much, Mr. Chairman. My first amendment is simple. It would require psychiatric hospitals to keep a daily log of incidents that result in the injury or death of a patient or a staff member and provide that report to their top state officials. This amendment stems from the year-long investigative series by the Tampa Bay Times. It's currently being published that details violence within Florida's state mental health treatment facilities. Nearly 1,000 patients have been ordered to the hospital for close supervision, have injured themselves or someone else in Florida. This may be happening in other states, but after significant staffing and treatment cutbacks since 2009, incidents and suicides have nearly doubled in the state's psychiatric hospitals. Additionally, over the past 5 years, at least 15 people died in Florida psychiatric hospitals after they injured themselves or were attacked by another patient. This series found that since 2005, the state has relaxed reporting requirements so that hospitals no longer need to disclose patient injuries. The reports that have been filed are in such disarray that accurately comparing them over time is impossible. We need to ensure that the hospitals are providing basic data to the state, and all states should do this, so they simply can't throw up their hands and say they didn't know about what was happening in their own hospitals. We can hold people accountable and work to fix the problem so that we keep track of the violent incidents inside these facilities. The Second Amendment is also pretty simple. It would require psychiatric hospitals to, the Second Amendment is a limited measure that would clarify existing law as to when it is permissible for states to disclose information about a person who dies while a patient in a psychiatric hospital to family members who have requested such information. Right now, current law says that states may disclose this information. But my amendment says only in the case of a deceased patient, it would require psychiatric hospitals to provide information to family members who request such information so they can better understand how their child or loved one died in that mental institution. We need greater clarity in this law. It may not be perfect as it's currently drafted, but I'd like to ask for our colleagues' help here today. If these kind of conditions are happening in Florida, they could very well be happening in your states. I hope not, but at least let's get some basic reporting information on deaths and injuries, and then allow family members, when someone dies in the state's care, to at least find out what happened in those circumstances. And at this time, I yield to Mr. Pallone.
I understand that our staffs are continuing to work on this, and I hope we can continue the dialogue. I understand that you are willing to withdraw it and continue to talk, so I would leave it at that at this point. If I don't know if anyone on the other side would like to comment.
Yeah, and reclaiming my time, I'd like to ask Congressman Murphy, who's the lead sponsor, if he would work with me on the language. It may not be so precise, but I think if you've examined the series here, it's really outrageous what's happening. And if we can
Absolutely.
get that basic information reported, it would be an improvement.
Gentlelady would yield for a moment.
yield
Yes,
to Mr.
it's a very heartbreaking story of what happened in Florida. As you say, it probably is happening in other states. Yet we need to address this issue, and I'll be glad to work with you on that.
Thank you. And with that, I'll withdraw both amendments. Thank you, Mr. Chairman.
The chair thanks gentlelady. The amendments en bloc are withdrawn. Are there any other amendments to the amendment in nature of substitute? For what purpose, gentlelady seek recognition?
Mr. Chairman, I have an amendment number 26 at the desk.
The clerk will report the amendment.
Amendment to the amendment in the nature of a substitute to H.R. 2646 offered by Ms. Schakowsky.
Without objection, the reading of the amendment is dispensed with, and the gentlelady, Ms. Miskowski, is recognized 5 minutes in support of the amendment.
Thank you, Mr. Chairman. My amendment would create a much-needed demonstration project to help create and expand behavioral health crisis systems. Unfortunately, many people who are experiencing severe mental health crises have few places to turn for immediate help. Instead, they most often end up in the emergency room, which is not only costly, but often does not have the necessary resources to effectively manage and de-escalate crises. In 2010, 2.2 million hospitalizations and 5.3 million emergency department visits involved a diagnosis related to a mental illness. My amendment would authorize $10 million a year for 5 years to create and implement behavioral health crisis systems. This amendment mirrors a proposal from the President's FY16 budget, which included $10 million in new funding for such a demonstration project. This funding could be used for services such as 24-hour crisis stabilization lines that provide peer supports, peer crisis services, mobile crisis services, short-term crisis residential services, and community-based follow-up services. All of these help to avoid expensive hospitalizations and improve outcomes for adults and children living with behavioral health conditions. I have personally seen the impact that a behavioral health crisis center can have on people in crisis. In my district, the Turning Point facility in Skokie has a program called The Living Room, which provides an alternative to the emergency room for adults in crisis. The Living Room's talented team of professionals, including therapists, nurses, and peer counselors, work to help individuals in crisis by providing support and assistance, referrals for shelters, healthcare services, and a safe space for individuals. But it is clear that we need more places like the Living Room, as many people with serious mental illnesses experiencing a crisis can only turn to overworked and often ill-equipped emergency rooms for the care and support they need. Others end up in prisons. And I urge my colleagues to support this amendment. And I yield to anyone, or I yield back.
Chair, thanks, gentlelady. Is there further discussion on the Schakowsky amendment? Seeing none, if there's no further discussion, the vote occurs on the amendment.
And if I could have a roll call vote.
The clerk will call the roll.
Mr. Guthrie? No. Mr. Guthrie votes no. Mr. Barton? Mr. Barton votes no. Mr. Whitfield? Mr. Shimkus? Mr. Shimkus votes no. Mr. Murphy? Mr. Murphy votes no. Mr. Burgess? Mr. Burgess votes no. Mrs. Blackburn? Mrs. McMorris Rogers? Mr. Lance? Mr. Lance votes no. Mr. Griffith? Mr. Griffith votes no. Mr. Bilrakis? Mr. Bilrakis votes no. Mr. Long? Mr. Long votes no. Mrs. Elmers? Mr. Bouchon? Mr. Bouchon votes no. Mrs. Brooks? Mrs. Brooks votes no. Mr. Collins? Mr. Collins votes no. Mr. Upton? Mr. Upton votes no. Mr. Green?
Aye.
Mr. Green votes aye. Mr. Engel? Mr. Engel votes aye. Ms. Capps? Ms. Capps votes aye. Ms. Schakowsky? Ms. Schakowsky votes aye. Mr. Butterfield? Mr. Butterfield votes aye. Ms. Castor? Ms. Castor votes aye. Mr. Sarbanes? Mr. Sarbanes votes aye. Ms. Matsui? Ms. Matsui votes aye. Mr. Lujan? Mr. Lujan votes aye. Mr. Schrader? Mr. Schrader votes aye. Mr. Kennedy? Mr. Kennedy votes aye. Mr. Cardenas? Mr. Cardenas votes aye. Mr. Pallone? Mr. Pallone votes aye. Chairman Pitts?
No.
Chairman Pitts votes no.
Members seeking recorded vote, Ms. Morris Rogers.
Mrs. McMorris Rogers votes no.
Ms. Blackburn.
Mrs. Blackburn votes no.
The clerk will report the vote.
Mr. Chairman, on that vote, there were 13 ayes and 16 nays.
The nays have it. The amendment is not agreed to. Are there any other amendments to the
Chairman?
information receptor? Mr. Butterfield, are you recognized for offering an amendment?
Yes, sir.
What's the number?
Number 4, Butterfield 4.
Number 4. The clerk will report the amendment.
Amendment to the amendment in the nature of a substitute to H.R. 2646 offered by Mr. Butterfield of North Carolina.
Without objection, the reading of the amendment is dispensed with. And the gentleman, Mr. Butterfield, is recognized 5 minutes.
Thank you, Mr. Chairman. My amendment would allow a social worker with a doctoral degree and the expertise relevant to the position to also serve as assistant secretary as defined in the underlying bill. Let's not make the qualification to serve so restrictive. Some of the reforms in the Helping Families and Mental Health Crisis Act of 2015 do not take into account the various healthcare professionals who work in the mental health space and who are on the front lines every day working with individuals suffering from mental and behavioral health illness. For example, social workers are one of the largest groups of professional mental health and substance abuse service providers, yet this bill significantly limits the role of social workers. Social workers, Mr. Chairman, are trained professionals, and their role should be expanded, not unnecessarily restricted. Social workers are critical to the future of the mental and behavioral health infrastructure in our country, especially as efforts are made to ensure individuals are connected with the mental and behavioral health services they need. Social workers touch many American lives through work in public schools and veterans hospitals and general and special service health care facilities, substance abuse prevention and treatment programs, child protective services, family service settings, and long-term elder care facilities. Mr. Chairman, have I run out of time? Was the clock reset?
I think, unfortunately, the clock was not set.
I have two
Gentlemen,
paragraphs, and I'll be finished.
Go ahead.
They are also on the front lines working in teams and in a variety of settings. There is no reason that a PhD educated social worker cannot serve or should not serve as assistant secretary. They are highly trained, highly utilized healthcare professionals who are on the front lines. Mr. Chairman, I would ask that this amendment be considered.
Chair, thanks you, gentlemen. Is there further discussion on the Butterfield amendment? Mr. Barton's recognized, 5 minutes. Strike the last word.
Mr. Chairman, I don't have a position on Mr. Butterfield's amendment, but we have a very special guest in the audience. Sitting at the back of the room by the door is Mr. Don Sisson, who is a special assistant to the President of the United States for Legislative Affairs and House Legislative Affairs Liaison. And he has said he wants to work with us on a bipartisan basis. So we welcome you to the committee, and hopefully you can do some good right now. Yeah, and a former Rules Committee staffer.
Chair, thanks the gentleman. Is there further discussion on the Butterfield amendment? Seeing none, the vote occurs on the amendment.
Mr. Chairman, I thought Dr. Murphy was going to comment on it. I wanted to hear his position on it, but if he's not going to speak, I'm ready to.
Gentleman, Dr. Murphy's
yes.
recognition.
My wife's a social worker. You want her to be appointed? We can take care of this whole bill right away.
Let's talk about this before the full committee.
Okay, thank you.
Markup. I'll withdraw the amendment.
Thank you. Thank you.
The gentleman withdraws the amendment. Are there other amendments to the amendment?
Mr. Chairman, I have an amendment at the desk.
Mr.
Amendment to the amendment in the nature of a substitute to H.R. 2646 offered by Mr. Ben Ray Lujan of New Mexico.
Without objection, the reading of the amendment is dispensed with. The gentleman, Mr. Lujan, is recognized 5 minutes in support of his amendment.
Thank you, Mr. Chairman. This amendment to H.R. 2646 ensures that adolescents have access to intervention and treatment for mental illness. Building off the Early Childhood Intervention Program in Section 204 of Congressman Murphy's bill, my amendment would establish grants for programs targeted at individuals from 12 to 25 years of age with the goal of prevention of chronic and serious mental illness. In its current form, only children from birth until 12 years of age are eligible for the Early Intervention and Treatment in Childhood program. However, the peak onset of the first episode of psychosis for psychotic disorders such as schizophrenia occurs between 15 and 25 years of age. An abundance of schizophrenia episode, RAISE, supports the value of early intervention following the first episode of psychosis. In addition, coordinated specialized services offered during or shortly after first episode of psychosis are effective for improving clinical and functional outcomes among young and younger adults. My amendment would ensure that there'd be a continuity of care for an age group that has a critical window to receive treatment. Furthermore, it would authorize the Secretary of Health and Human Services to award grants to entities to better research mental health issues and possible treatments. Recent estimates show that nationally, 1 in 5 adolescents have a diagnosable disorder. However, a majority of these adolescents do not seek care due to a wide variety of barriers to care and due to the negative stigma associated with mental health issues. In my home state of New Mexico, about 17,000 adolescents, or 10.6% per year from 2009 to 2013, had at least one major depressive episode during the year prior to being surveyed. Nationally, this number was 8.7, yet 60.7 of these adolescents did not receive treatment. We must transform how we view mental illness if we're going to be successful in treating those in need. Although it is important that we widen access of psychiatric and psychological and supportive services for individuals with mental illness and families in a mental health crisis, we must also broaden the mental health framework to guarantee that all those who need help receive it. We must be prepared to fully fund our mental health system while simultaneously working to build a more robust system. What we truly need are reasonable, sensible reforms. As it stands, the current language of the bill would leave a hole for the age group where we most commonly see the highest incidences of first episode of psychosis. To make a difference, we must prioritize early interventions and treatment for adolescents. Mr. Chairman, I think as we've seen today, this may be the last amendment offered. That we've seen, I think, almost over 30 amendments offered today, and only a handful accepted. There's clearly a lot of work to do here as we try to get buy-in and make sure that Democrats and Republicans are able to work together. But again, almost half the committee on this side of the aisle, where we all represent the same number of people, Mr. Chairman, we have needs in our communities, and we're also sharing the voices of the most vulnerable all across America. So I'm certainly hopeful maybe this one's got a chance, Mr. Chairman, but that we're able to include many of these provisions today. And I remain hopeful that come markup in the full committee before we go to the floor, that there truly will be a bipartisan bill, a comprehensive bill, that we can all be proud of and that we can ensure will get to the President, receive his signature so we can get to work of helping those most in need. And with that, Mr. Chairman, I yield back the balance of my time.
Chair, thanks you, gentlemen. Is there further discussion on the Lujan amendment? The chair recognizes the gentlelady from Illinois, Ms. Schakowsky. 5 minutes.
Thank you, Mr. Chairman, and thank you, Mr. Lujan. I just wanted to especially and personally thank you for this. Because I'm the grandmother of an adolescent who fit into that category, and because we were able to get, although with great difficulty and frankly at enormous expense, to find the kind of interventions that actually turned her life around, we don't want to be in a position, I can only imagine if we had not been able to do that, what she would have done with the destructive behaviors that she was engaged in, et cetera. And so I just feel like this is an opportunity for us to say to adolescents around this country, we will do something to help you now and to make the rest of your life the wonderful life that my grandchild has now. So thank you.
The gentlewoman yield? Would the gentlewoman yield?
Yes, I would be happy to yield.
Before we conclude, I just wanted to ask unanimous consent to add 3 letters into the record addressed to the various chairs and ranking members of the committee. One is from the National Association for Rural Mental Health. One is from the International Society for Ethical Psychiatry and Psychology. One is from the National Council on Independent Living. And lastly, a letter from the American Bar Association.
Without objection, so ordered. And I will remind members that if you have asked for documents to be included in the record, please submit your materials to the majority staff for inclusion in today's markup record. Is there further discussion on the Lujan amendment? Seeing none, the vote occurs on the amendment. You want to record a vote? Recorded vote. Clerk will call the roll.
Field. Mr. Shimkus. Mr. Shimkus votes no. Mr. Murphy. Mr. Murphy votes no. Mr. Burgess. Mr. Burgess votes no. Mrs. Blackburn. Mrs. McMorris-Rogers. Mrs. McMorris-Rogers votes no. Mr. Lance. Mr. Lance votes no. Mr. Griffith. Mr. Griffith votes no. Mr. Bilrakis. Mr. Bilrakis votes no. Mr. Long. Mr. Long votes no. Mrs. Elmers. Mr. Bouchon. Mr. Bouchon votes no. Mrs. Brooks. Mrs. Brooks votes no. Mr. Collins. Mr. Collins votes no. Mr. Upton. Mr. Capps. Ms. Capps votes aye. Ms. Schakowsky. Ms. Schakowsky votes aye. Mr. Butterfield. Mr. Butterfield votes aye. Ms. Castor. Ms. Castor votes aye. Mr. Sarbanes. Mr. Sarbanes votes aye. Ms. Matsui. Ms. Matsui votes aye. Mr. Lujan. Mr. Lujan votes aye. Mr. Schrader. Mr. Schrader votes aye. Mr. Kennedy. Mr. Kennedy votes aye. Mr. Cardenas. Mr. Cardenas votes aye. Mr. Pallone. Mr. Pallone votes aye. Chairman Pitts.
No.
Chairman Pitts votes no.
Are there further?
Mr. Chairman, on that vote, there were 13 ayes and 16 nays.
The nays, the amendment in nature of a substitute. If there's no further discussion, the vote occurs on the amendment in the nature of a substitute as amended.
Chairman, we'd ask for a recorded vote.
The clerk will call the roll.
Mr. Guthrie. Mr. Guthrie votes aye. Mr. Barton. Mr. Barton votes aye. Mr. Whitfield. Mr. Shimkus. Mr. Shimkus votes aye. Mr. Murphy. Mr. Murphy votes aye. Mr. Burgess. Mr. Burgess votes aye. Mrs. Blackburn. Mrs. Blackburn votes aye. Mrs. McMorris-Rogers. Mrs. McMorris-Rogers votes aye. Mr. Lance. Mr. Lance votes aye. Mr. Griffith. Mr. Griffith votes aye. Mr. Bilrakis. Mr. Bilrakis votes aye. Mr. Long. Mr. Long votes aye. Mrs. Elmers. Mr. Bouchon. Mr. Bouchon votes aye. Mrs. Brooks. Mrs. Brooks votes aye. Mr. Collins. Mr. Collins votes aye. Mr. Upton. Mr. Upton votes aye. Mr. Green.
No.
Mr. Green votes no. Mr. Engel. No. Mr. Engel votes no. Ms. Capps. No. Ms. Capps votes no. Ms. Schakowsky. No. Ms. Schakowsky votes no. Mr. Butterfield. No. Mr. Butterfield votes no. Ms. Castor. Ms. Castor votes no. Mr. Sarbanes. Mr. Sarbanes votes no. Ms. Matsui. Ms. Matsui votes no. Mr. Lujan. Mr. Lujan votes no. Mr. Schrader. Mr. Schrader votes aye. Mr. Kennedy. Mr. Kennedy votes no. Mr. Cardenas. Mr. Cardenas votes no. Mr. Pallone. Mr. Pallone votes no. Chairman Pitts.
Aye.
Chairman Pitts votes aye.
Are there any other votes not recorded? Anyone seeking vote? Clerk will report the votes.
Mr. Chairman, on that vote, there were 17 ayes and 12 nays.
The ayes have it, and the amendment in the nature of a substitute is agreed to. The question now occurs on forwarding H.R. 2646 as amended to the full committee.
And on that, we'd ask to record a vote, Mr. Chairman.
The clerk will call the roll.
Mr. Guthrie. Aye. Mr. Guthrie votes aye. Mr. Barton. Aye. Mr. Barton votes aye. Mr. Whitfield. Aye. Mr. Whitfield votes aye. Mr. Shimkus. Aye. Mr. Shimkus votes aye. Mr. Murphy. Aye. Mr. Murphy votes aye. Mr. Burgess. Mr. Burgess votes aye. Mrs. Blackburn. Mrs. Blackburn votes aye. Mrs. McMorris Rogers. Mrs. McMorris Rogers votes aye. Mr. Lance. Mr. Lance votes aye. Mr. Griffith. Mr. Griffith votes aye. Mr. Bilrakis. Mr. Bilrakis votes aye. Mr. Long.
Aye.
Mr. Long votes aye. Mrs. Elmers. Mr. Bouchon. Mr. Bouchon votes aye. Mrs. Brooks. Mrs. Brooks votes aye. Mr. Collins. Mr. Collins votes aye. Mr. Upton. Mr. Upton votes aye. Mr. Green.
No.
Mr. Green votes no. Mr. Engel. Mr. Engel votes no. Ms. Capps. Ms. Capps. Mr. Sarbanes. Mr. Sarbanes votes no. Ms. Matsui. Ms. Matsui votes no. Mr. Lujan. Mr. Lujan votes no. Mr. Schrader. Mr. Schrader votes aye. Mr. Kennedy. Mr. Kennedy votes no. Mr. Cardenas. Mr. Cardenas votes no. Mr. Pallone. Mr. Pallone votes no. Chairman Pitts.
Aye.
Chairman Pitts votes aye.
Are there any other members seeking to have a recorded vote? Seeing none, the clerk will report the vote.
Mr. Chairman, on that vote, there were 18 ayes and 12 nays.
The ayes appear to have it. The ayes have it. The bill is agreed to. Without objection, the staff is authorized to make technical and conforming changes to the legislation considered by the subcommittee today. So ordered. Without objection, the subcommittee stands adjourned.